YENEPOYA Naturopathy and Yogic Science College and Hospital and National Institute of Naturopathy, Pune.
The truth of our medicine will always win out. The truth of what we are doing will always survive. As we all know, naturopathic medicine is a form of alternative medicine. A wide array of practices branded as natural, non-invasive, and promoting self-healing are employed by the practitioners. Naturopathic system of medicine emphasizes the prevention and treatment of disease by promoting individual inherent self-healing process. Nature Cure utilizes easy and efficient natural method of diagnostic technique like facial diagnosis, iris diagnosis, tongue and pulse diagnosis, in addition to clinical and physical examination. The diagnosis process should flow from an extensive case history and physical examination to differential diagnosis that lists possible alternative for the presentation within the patient.
Hence, this workshop aims to create an awareness of a use of different types of diagnostic method in naturopathy system under the title Prakruthi Vijnana, the science of naturopathic diagnostic.
In this workshop, we provide hands-on training experience from subject experts and allow the participant to appreciate the nuance how naturopathic diagnostic method help in clinical practice. Also, upgrade the evidence-based knowledge of the tested diagnostic techniques.
It is more important to understand the imbalance in our body's basic system and restore balance rather than name the disease and match the pill to the ill.
We are proud to claim that our institution, YENEPOYA Naturopathic and Yogic Science and College and Hospital, is the first naturopathic yogic science and college and hospital brought up in South Canada, deemed to be university, which has integrated conventional medical facilities. Now I request our beloved principal, Dr. Punit Raghavendra, to escort today's dignitaries to the dais. Thank you, sir. Let us begin this program by invoking the presence of Almighty. So I request Fatima Harris to recite the prayer.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. In the name of Allah, most gracious, most merciful. Praise to be to Allah, the cherisher and sustainer of the worlds, most gracious, most merciful, master of the day of judgment. Thee do we worship, and thine aid we seek. Show us the straight way, the way of those on whom you hast bestowed thy grace, those whose portion is not wrath, and who go not astray.
Nothing can be more reassuring and heartwarming than the affectionate word of welcome. To begin this program, I would like to request our beloved principal, Dr. Punit Raghavendra, to deliver the welcome address.
Very good morning to all. Respected sir, as well Director ma'am, Shambhu sir, dear colleagues and dear friends. On this one of this auspicious day and a unique day, the reason because we have gathered from all over India, one of the unique workshops which have been focused on the diagnosis in the naturopathy, right? You know that a good diagnosis is nothing but the around 50% of the cure. That's what we always say. The right diagnosis make itself the right management that gives you the where you have the fault and what we have to correct. So with this, it's my privilege to welcome our real support sir, today's president, Dr. Shripati Rao sir. So warm welcome you to the today's inaugural program, sir. And our second person of today's event, so as the experience of the 25 to 30 plus in the stream of an academician as well clinician. So you can see the young and energetic ma'am. So Dr. Satyalakshmi ma'am, she is the director of the NIN. When we planned about this event, the day we planned, I spoke with ma'am. I said to the ma'am, till now we have seen various kinds of the conferences, more of into the yoga projects. Hope we have been never seen anything from the naturopathic background of you. And the second more thing, we always see into the conferences where how many people they will participate in the conferences, but among that 50% will be the out of the conference hall. Correct? So that's the reason I told to the ma'am, we don't want to happen that, so we will have one workshop. She said, immediately she approved, okay, we will go ahead with this. So with this, her kind guidelines and the support, we are there here. So ma'am, on behalf of YENEPOYA Naturopathy, as well as behalf of NIN also, I'll be welcoming you. I request Dr. Padma Shri to welcome her. And we have along with us Dr. Shambhu, Dean, Dental College. Since I'm here since 2 years, working in YENEPOYA, from the day one, we are in the very close friends, and we have taken with the several guidelines in conduction of the events as to provide the best of the knowledge to the student as a clinician as well to the academics also. That's the reason he has become the dean into the YENEPOYA Dental College. So, sir, we welcome you on behalf of the YENEPOYA as well into the NIN. I request Dr. Madan to welcome him with the flower. And also we have people gathered, the main assets of the today's workshop. I hope without a patient, any doctors will not survive. As well, without a student, a teacher cannot be there, right? So today's delegates, you have been traveled all the way to earn the best of your knowledge, the good of your knowledge from this end. So taking your time and traveling to here. So hereby I welcome to all the delegates from the various corners of the India. So warm welcome to the delegates. And also I submit my sincere welcome to my backbones, all my colleagues and my students, and to the media people and one and all. Welcome to all.
Thank you, sir. I would also like to extend my warm welcome to you, sir.
Light is a symbol of knowledge, wisdom, and prosperity. To solemnize this event, I would like to entreat our today's guest of honor and all the dignitaries in the dais to illuminate the event by lighting the lamp. Now, I invite Veena Sumati and Swati Krishna to chant the prayer.
शुभं करोति कल्याणम् आरोग्यं धनसम्पदा शत्रुबुद्धिविनाशाय दीपज्योति नमोऽस्तुते दीपज्योति परब्रह्म दीपज्योति जनार्दन दीपो हरति पापानि सन्ध्यादीपं नमोऽस्तुते.
Now I request today's guest of honor, Professor Dr. Satyalakshmi, Director, NIN Pune, to address the gathering.
Good morning, everyone. It gives me immense pleasure to come to any such coming together of naturopathy professionals, and more importantly, to gain knowledge and to share knowledge. And today we are going to have a detailed hands-on training or workshop, whatever you may call, on naturopathy diagnostics. This is little ignored or less paid attention subject. So we thought we'll start with that. So I thank the YENEPOYA management for giving this kind of support and showing keen interest on developing naturopathy. Just now we had a brief discussion with the Pro Vice Chancellor and also the Dean Faculty of Dentistry, how we can go about promoting this system in YENEPOYA, because naturopathy is now spreading very fast, much more than our expectations. So we should make sure that the quality is not compromised and the science is practiced as science. So that requires a little bit of, keenness in doing so. So otherwise what happens is the science get diluted and non-science will be practiced, which is what is happening in many other areas of science. So it is our responsibility as now family members of naturopathy to make sure that naturopathy is practiced as science. Natural science is very intricate. It's not mechanistic science where 1 + 1 is 2. 1 + 1 can be infinite, it can be minus, it can be anything. So there are n number of other factors that come in the way. So we need to be very, very vigilant and proactively pursue to make this science more rational, more applicable, more serving to the humanity. Yeah, with this, we thought we'll collaborate with YENEPOYA, not only in this program, but in future also in many other areas. Sir, we will be more than glad to collaborate and work together. Anyone who comes into the field of naturopathy, and it is our responsibility from National Institute of Naturopathy to handhold, collaborate, and make sure that it is practiced as it should be. Thank you very much once again for all of you for choosing to come to this program. Thank you.
Thank you for your enlightening words, ma'am. Now I request Shreyasi Patil of 3rd year BNYS to introduce our guest, Dr. Shambhu, Dean, Faculty of Dentistry, YENEPOYA Dental College and Hospital.
Good morning one and all present here. I, Shreyasi Patil of 3rd year BNYS, here to give a brief introduction about Dr. Sham S. Bhatt. Dr. Sham S. Bhatt is a senior professor and dean, Faculty of Dentistry, YENEPOYA Dental College. He had completed his BDS in the year of 1987 and completed his MDS in Pediatrics and Preventive Dentistry in the year of 1990 from Bapuji Dental College, Davangere. He has 34 years of experience in the dental department, both in the field of academics and clinicals. He has around 129 publications. He is a lifetime member of Indian Dental Association and Indian Society of Pediatrics and Preventive Dentistry. He is also a member of International Association of Pediatric Dentistry. Now I request Dr. Sham S. Bhatt sir to address the gathering.
Namaste and a very good morning to all. Honorable Pro Vice Chancellor Dr. Shripati Rao sir, Madam Satyalakshmi, the Director of NIN, Pune, Dr. Punit Raghavendra, Principal of YENEPOYA Naturopathy College, and esteemed all members or maybe the organizing committee as well as the delegates. When Dr. Punit called me for this function, I was in two dilemma whether to attend or not. Then I asked who are the members or the people who are attending this or maybe the guests for this program. Then he said Dr. Shripati Rao is the presidential part of this program and Dr. Satyalakshmi is the person who is collaborating with us in this program. Then I thought, why not, when two big alumni are there, big people are here, why not with them in the stage with them? Why I say this? Because Dr. Shripati Rao is the first principal or maybe the first person who started this dental college under the YENEPOYA banner, the first college which happened to be now he is working 35th year or 34 years, we are together in the YENEPOYA banner. Why I say this is under his leadership, dental college has come. Many things happened in this campus. Following this medical college, you know whatever the other things happened in the 11 streams of institution has come in this campus. And when you work under him, his leadership qualities, his administrative skill, and apart from that great teacher, and at par his oration lectures, one should listen here. And because of that, he has served as a executive committee member of Dental Council of India and made the many changes in our system of education or a curriculum. Sir, really thanks for the things to share with you, sir, today. And if you see about Madam Dr. Satyalakshmi, I was not only that just because of today's program I know about her, I heard many her lectures earlier too, because one of our family members are doing yogic sciences classes or maybe the wellness centers. When you come across to her profile, if you see that part, he is mainly concerned on diet and sleep disorders, especially for menstrual cycle. I think this is the topic she is mainly dealt. I personally feel today's people are here, gathered here. Nari Shakti has makes the main stream of topic. I think Prime Minister always mention about that. People are attending so much here. The day will come, all will take over by the people of Nari Shakti. Doesn't mean other people will go away. Please, that are not the meaning of that. Now coming to the topic of today's, our topic of yogic or naturopathy. I personally believe in it. I practice this too, and plus not that, Bapuji, our Gandhiji also followed this, and his topic of guide to health is made the difference for the people. And in 1920 onwards, I think this is on the stream of main part of in the India. And coming to the administration part, Ayush under umbrella of three things, that is Center of Council of it's in Delhi in 1986 onwards. Again, Madam's place is 89 onwards, if I'm not wrong, 89 onwards. And one more is yoga is at the Delhi, that is on 98 onwards. And lastly, I have to tell about much more, one more things for the dental point of view. In our NEP 2020, Dental Council of India is made the yoga and naturopathy as a elective syllabus. It is going to come anytime. Again, I have to bend on Dr. Puneet for this to how to collaborate with our topic. Thank you. Have a nice day. Enjoy that.
Thank you for your kind words, sir. I'd like to request President of today's inaugural ceremony, Honorable Pro Vice Chancellor Dr. Shripati Rao, to deliver presidential address.
Good morning. I hope all are not sleeping. Good morning, I said. That's the way it should be. Respected chief guest of our function, Dr. Satyalakshmi from the National Institute of Naturopathy, Pune, Dr. Shambhu, my dear colleague with whom I spent almost 35 years in this institution and in the university, Dr. Puneet Raghavendra, the principal of the college. For the last 2 years, we are associating very closely because as the Pro Vice Chancellor, I am responsible for streamlining the different institutions under Ayush and other institutions. My condition is that I don't want to put my nose into dental college anymore. I will look after other things. So that's how I got into this, and I really enjoy going around and meeting these people, learning a lot of things from them. So I'm really inspired that today the Naturopathy College of YENEPOYA and the National Institute at Pune conjointly organized this workshop for the benefit of all the delegates who have come from different parts of the country. At the outset, as the Pro Vice Chancellor of the university, I extend you all a very, very warm welcome once again to this prestigious university campus. My request that before you leave this place, you also make it a point, I'm sure you'll organize, go to our other campus and also witness how we have developed from the very inception the Naturopathy College, because this started only in the year 2021. The first batch is going to take exam next year only. So you can see the treatment section what you have developed in the very inception itself. And all these speakers and the experts who have come from different parts of the country, I want all of you to suggest how we can improve our Naturopathy College. And Madam, I'm very, very thankful that you said that in future we'll be collaborating with others. That's what we look for. And I can, as a Pro Vice Chancellor, one thing I'll tell you, we have an excellent research center here. We have a provision for startups. All are welcome. You can collaborate with us. You can do your research. Our university is always with an open hand welcome all those people who are interested in doing research. I feel a lot of research can be done under your banner, the naturopathy. So I want to support this. and I will be always there supporting all my colleagues to do this. YENEPOYA University, YENEPOYA College itself made a humble beginning in 1992 with our dental college, as Shambhu said. I was fortunate enough to join in 94 as the dean of the college, and then I continued till 2019, and after superannuation I wanted to relax and go back, but our chancellor didn't allow me to go back. He said, no, you have to work for us. So I joined the university then later and became pro-vice chancellor and looking after all other institutions. We have got almost 10 faculty now, 11 faculty and 10 institutions. Other than dental and medical, I look after all other institutions. So that's my privilege to go around. And I always feel, I keep telling my colleagues, if at all at this age I am active, it's because I run around and go to all these institutions, get inspired by the people who are working there, looking at the young children who are so active. As pointed out by Shambhu, Nari Shakti is very strong in all the colleges, not only in naturopathy, in all the colleges. If you see, I really don't know why the boys get matured little late. That's why they don't want to join for all this professional college. But I'm very happy. You always say that if the lady is trained, educated well, they will be the backbone for the family. They will see that their children are educated well. So that's what we look for, and we look for a bright India in future under the guidance of all our Nari Shakti. I don't want to speak about your program because I have very little knowledge about your diagnostic aids, but then diagnosis is a common thing in any stream of medicine, irrespective of what stream you are. It's very, very important, as Puneet said. Once you do a proper diagnosis, the 50% of your response is over. You can cure the disease because you get the confidence that you have found the root cause for the disease, so that you can properly treat. Now, what sort of treatment you give, it depends upon the different streams of medicine. I am not talking about that, but diagnosis in general is common. We always say that the student should have the patience to listen to the patient first. Never jump in and start asking questions. This is how I keep telling to all the students, because if you don't give a patient hearing to the patient I am talking, you will not be able to actually know their agony and what suffering they have. Only after you listen to them properly, then you can put forward certain questions to know much more than that. So history is the most important. Most of the time in the past, there were no diagnostic aids. When I was a student in 70, there were not many diagnostic aids. But if you look at the physicians, only by auscultation and palpating the pulse, they could diagnose most of the diseases. That skill is vanishing. I am so sorry to say that. It is vanishing in allopathy now, because everyone depends upon the investigations only. I'll tell you, nothing like clinical examination, nothing like that. And you should all develop that skill to clinically diagnose. All the other investigations should be left last. Only if it required, you should ask for it. So develop the skills. I'm sure today we'll have plenty of different diagnostic aids. They'll be talking how, through naturopathy, how they diagnose different ailments in the body. I will not talk about it because the experts are there. But as a maxillofacial surgeon, I'm more concerned about the oral cavity, and we keep playing with the tongue and the oral tissues and the jaw bones. I'll tell you, tongue is a mirror image of our body's functioning. There are a lot of things you can learn. I don't know how they go ahead with it, but as a oral surgeon or as a dentist, for example, we always, along with the teeth, we examine the tongue, which gives a lot of information to you. How a normal tongue looks, it is pinkish in color. You will be able to see all the papillas very prominently with a thin coat of a whitish thin coat. It should be there. If that thin coat is not there, that means your tongue is not functioning, your body is not functioning. You know why? That thin coat you get because there is always a process of cellular change. The old cells die and the new cells form. Only if that happens, then only it will survive. And this white thing what you get is actually desquamated epithelium. When it gets hydrated, it gives that whitish look. It should be there. I'm not telling that there should be a thick coat, there should be a thin coat that shows that the tongue is functioning well. If the tongue is functioning well, the whole body is functioning well. There's a replica of that. That's the importance of knowing it. For example, if you see a very thick coat on the tongue, I'm just telling simply, does it look healthy? No, absolutely no. It can be due to two reasons. One, the body digestive system is not functioning well. You are not doing the proper eating and swallowing habits. You know, the swallowing and the eating is the one which actually scrapes the surface and removes this white coat and maintains a very thin layer of this coat. If there is a thick one, that means your body is not functioning well, you are not maintaining your health well. This is a simple thing you come to know, and then you go further. For example, you have the vitamin deficiency, the most commonest one, B12 or folic acid. If there is a deficiency, you get a beefy red color. Whole thing looks red in color, which is very sore, and papillas, if you look at that, is totally atrophied. That's a very scary look. Rarely you get it now because most of our food, there are supplements, so it doesn't reach to that level, except you may get a burning mouth, all other sensations. But I have seen as a student, I have seen so many cases of pernicious anemia because of the lack of this. So there are so many things, hairy tongue, you get a geographic tongue, all this, so many things you see. So make it a habit, not just looking at that, go thoroughly, examine each part of the body, you will be able to diagnose so many diseases. I don't want to elaborate anymore because they are going to speak about it. My dear colleagues, the students and the delegates who have come from different parts, thank you for attending this. Always you should make it a point to attend the workshop anywhere, because what you learn in a day in a workshop is much more than what you will be learning throughout the year. Because all the stalwarts in the field come and give lectures. From their experience they are going to talk, so you will get a lot of knowledge. So make it a point to attend workshops but not conferences. I always used to tell my student, if you want to go to workshop, I am there, I will support you as a dean here. I know conference what you do, because when you go for the conference, my PGs will not be there, they will be roaming around seeing the city only, because it may not interest them much. Whereas in a workshop there is a one-to-one contact and one-to-one deliberations. You will be very keen to listen to them and see what's happening. So, welcome to once again to our campus, and go around and see our university campus. I always say that because a must, after traveling such long distance, if you don't see, I feel sometimes a waste. Because you can take good things from here, and I always say that we are open-minded. You have got any good suggestions, please give it to us. We will try to improve. I hope that soon our Naturopathy College will have its own building, and we will strive hard to develop one of the finest Naturopathy college in this university, because the management is very, very keen on Ayush. I will tell you, our Chancellor has got a lot of faith in this, more than allopathy I can say. He is a follower of this. Every day he does yoga. For the last 30, 40 years. He gets up at 3:30, 4 o'clock, and he does yoga and all the things. So when we have a leader like him, who will guide us, I am sure we will be able to develop all this institution well. So take it as a challenge, Dr. Raghavendran, and develop our institution. Thank you one and all.
Thank you, sir, for your inspirational words. As we have come to the end of today's inaugural function, I would like to request Dr. Padma Shri, Associate Professor, Department of Energy Medicine of YENEPOYA Naturopathy and Yogic Science, College and Hospital, to propose the vote of thanks.
Namaste all. It is a great honor and privilege to me to propose the vote of thanks in this great occasion. I take this opportunity to express my gratitude on behalf of YENEPOYA Naturopathy and Yogic Sciences College and Hospital and Director NIN and co-organizers of NIN. First and foremost, I would like to thank Chancellor, Pro-Chancellor, Vice-Chancellor and Registrar, YENEPOYA deemed to be university, in their absence for the constant support. I take this opportunity to express my deepest sense of gratitude to the director and co-organizers of NIN, who are the contributors of this event. My heartfelt thanks to the president of today's program, Honorable Pro Vice Chancellor Dr. B.H. Shripati Rao, who spared time from his busy schedule to grace this occasion. Thank you, sir. Now I request our principal, Dr. Puneet Raghavendra sir, to present the token of gratitude to our today's president, Dr. B.H. Shripati Rao. I would like to express my sincere gratitude to the guest of honor, Professor Dr. K. Satyalakshmi, Director, NIN, for the guidance, support and cooperation. Thank you, ma'am. I request Dr. B.H. Shripati Rao to present the token of gratitude to Director, ma'am. My heartfelt thanks to our today's guest, Dr. Shyam S. Bhatt, Dean, Faculty of Dentistry, YENEPOYA Dental College, for his gracious presence, cooperation and support. Thank you, sir. I request Dr. Madan Kumar, Domain Expert, Department of Yoga, NIN, who is the co-organizer of this event, to give the token of gratitude to our guest. Now I would like to thank our beloved principal, Dr. Puneet Raghavendra, who is the backbone of this event and the real reason for this workshop. We thank him for his guidance, encouragement and constant support. Thank you, sir. I express my sincere gratitude to YENEPOYA Dental College for providing this beautiful venue. I thank all the committees, IT departments, and all the faculties and students who worked hard and still working hard for the success of this event. Last but not the least, I thank all the participants who have come all the way from different parts of India. Thank you all. I conclude my vote of thanks with a beautiful quote from Rigveda, Ano Badraha Kritavo Yantu Vishwataha. That means, let good and noble thoughts and knowledge come from all the way from the universe, from all the directions. Knowledge is power. Have a blessed and enlightened day ahead. Thank you.
Thank you, ma'am. Now I request guests and all the participants to have their refreshment and gather for the first session of today's workshop on facial diagnosis by Professor Dr. Satyalakshmi, Director, NIN Pune, at sharp 11:15. Thank you all and have a wonderful session
ahead.
Ayush, Government of India, Bapu Bhavan, Pune. Ma'am have participated as a resource person at various medical colleges. She is a member of National Board for Promotion and Development of Naturopathy and Yoga, Ministry of Ayush, Government of India. Technical expert for National Accreditation, Board of Hospital and Healthcare Providers. Presented various papers on naturopathy and yoga. Participated in various television and radio talks. Published various articles in newspaper, magazines and books. Ma'am have received an award for excellence in health service from Government of Telangana State. Received Healthcare Excellence Award in 2017 from Honorable Shri Devendra Fadnavis, Chief Ministry of Maharashtra State. She is a chief editor of Nisarga Pacharvarta monthly magazine of NIN Pune. Now I request ma'am to hand over the session.
Murthy sir, you can put it here. If it is possible, you do so. Meanwhile, yeah. Yeah. Okay. Yeah. I think this is good enough, no? So welcome back. I am sure you are properly refreshed. Are you all ready? Okay. Before we get into the nitty-gritty of diagnosis, let's just quickly go back to the fundamentals of naturopathy. Okay. So naturopathy definition of health is slightly different from the regular conventional definition for health. Would somebody like to say what it is? What is? Yeah, exactly. It's a harmonious vibrations against the environment in which a human is positioned, right? So how do we assess these harmonious vibrations? That's the biggest challenge. And in fact, there are number of universities, organizations and even individuals who are studying on this, measuring vibrations per se. And next time NIN, we may even invite them. There is a couple, a doctor couple, and he is orthopedic, not orthopedic, I think he's a radiologist by training. And then later he went on to getting trained in functional radiology, and then his wife is a surgeon, but then now they have developed a keen interest on flower remedies. And then for flower remedies, again what is required is to measure vibrations, the vibrations of the flower and then the vibrations of human body. And in diseased condition, how these vibrations are varying, and as per the organ, the vibrations change, and as per the environment, the vibrations change. So they're even using lot of computer calculations to precisely understand these vibrations, and then coming up with flower remedies for that. So there is a growing interest in the understanding of naturopathy, but here today we are, first of all, you should not think that naturopathy diagnostics means it is something different. As rightly put it by Pro Vice Chancellor in his talk, diagnosis is diagnosis. What does it do to us? It helps us understand the pain and suffering of the patient first of all, and then as a professional we should also understand at what stage of the disease. There is a progression of disease, from where to where it will go we have a clear idea. In our pathophysiology we study the spectrum of disease, so at least we should be able to identify at what level is the patient now. If that is not understood, I think our strategies to deal with the problem may go haywire. So you have to be very, that's why it is called clinical precision. Clinical precision means exact. You have to be 100% sure what you are doing. So for that, diagnosis is a first step. Then next important thing that we should not miss is prognosis and management. With diagnosis we understand the status, but then based on that we should, and many other parameters included, we should come up with a prognosis. What this patient is going to go about, whether he is going to recover or not. If not, what it's going to be the management protocol. So for that sake also, diagnosis is very, very important, and based on which we also give reassurance, right? And all, how many of you have crossed third year? Almost all? All have completed? No? Okay. So we have what is called in all naturopathy clinics follow-up program. Every patient is given a follow-up program, right? After treatment, whether it is OPD or IPD, even after teaching yoga, we give them a step-by-step lifestyle management program, right? So in that, for reassurance, for giving them a follow-up, you have to have a clear idea at what stage the patient is and what was the management that has occurred during this period. That also requires some clear understanding of diagnostic tools and methods. Then another important thing is proper diagnosis also involves misdiagnosis. That's where we talk about differential diagnosis. A same case may appear, it's like our multiple choice. All look the same, all look more or less similar, but then only one is right out of that. So that is what we call not falling in the trap of misdiagnosis. Please, you have to be very, very cautious about that. Then public health planning. What is public health planning? When you diagnose, when you understand a disease, if there is some kind of disease which needs to be reported, you should be mindful of that also. So diagnosis will take you to that level of public health awareness. Most of the time we ignore this. During COVID time, it became very imperative. The moment you see COVID symptoms or signs, you have to report. Now, very recently, I think 2 weeks back, there were 3 cholera patients, cholera cases reported in Guntur district of Andhra Pradesh. Immediately there was an alert. You know, the public health department was completely geared up to see what went wrong, and all sewerage lines were, tested. So this kind of diagnosis, the moment you diagnose a case, if it has something to do or linked to public health, and we should act upon accordingly. Then the legal and ethical considerations. Sometimes there are accident cases or rape cases or any other abuse or violence kind of cases, but then they may come to us and we may diagnose, but then if there is a responsibility on our side to report it to the right authorities, we as professionals must do so. Then comes research and education. Again, thanks to YENEPOYA management, you have a nice research department here. And the data that you collect and systematic presentation in your case sheet and documenting it and keeping it for medical record sake will help you again to go back and do research on that. So whatever you see, whether they are signs or symptoms, sometimes you may think that it's not important to mention, but you are nobody to decide about it. If patient tells, if you simply jot it down, maybe someday there may come some new insights which may link this to that. Okay? So jotting down and keeping it for record sake so that it becomes a useful tool in education and research further. And the last and the least, if not the least, to bring down health costs. Now recently World Economic Forum in its report mentioned that more than 60% of world population is going bankrupt because of their health expenditure. And in many countries, it is still out-of-pocket expenditure. Not many get insurance cover. And our lifestyles and then now climate change situation is forcing everyone to undergo a lot of medical expenditure, and if we understand and then prevent and promotive health is promoted in a big way, lot of health expenditure can be averted. Just imagine a person cutting their food or investing more in physical activity can prolong becoming or avoid becoming diabetic. Say some is expected to become diabetic at the age of 45, is becoming diabetic at the age of 55. 10 years of life, a non-diabetic life, can how much it can save. Now people are using certain tools and algorithms are calculating this kind of preventive steps, and most of these are preventable and many risks are avoidable. We should not think that what can I do, I got this disease. No, you are responsible to your health. That is what we are essentially today sitting here to discuss. So that's why diagnosis becomes very, very crucial, and you cannot ignore it. And naturopathy system also has certain diagnostic tools which may help us understand the naturopathic perspective of disease progression. So what we study in pathophysiology is on one aspect that has to be there. There is no way of ignoring it. You have to be fully aware of that. The moment we talk about naturopathy diagnostic tool, it does not mean that you can undermine or you can ignore this. While this is so, we should also be fully aware of the naturopathy diagnostic tools on which early naturopaths spent quite a lot of time. Now I'll tell one or two persons, because I don't know how many of you are reading books, particularly old naturopathy texts. Now, how many of you have heard, am I well or sick? Can you raise your hands? Not even Dr. Shakti Vision? Okay. So, this is the first book translated to Indian vernacular language, that is Telugu, by Dronam Raju Venkatachalapati Sharma. In those days, 1880s, all the way he traveled to Germany, learnt German. It was not easy then. It's not like just online you book ticket and then go get into flight and then reach there. There were no flights. You have to travel by streamers, and quite a treacherous thing. And there were no German centers to teach German language, no online classes. So he learned the hard way, and then went there, and from Louis Kune, he stayed there for 2 years, learned all aspects of naturopathy, the new science of healing, and before that, am I sick or am I well or sick? This 2 books he has translated into Telugu. That's how it entered the scene of India. Naturopathy as a system of medicine. Naturopathy was practiced in so many other ways by then. So they all people, slowly, they could immediately get connected. And then naturopathy, of course, the spread is what we are seeing today. But in that, Louis Kune, he clearly talked about facial diagnosis. So he also talked about in his new science of healing, I think, the science of facial expression. This is not my presentation. It is actually supposed to be presented by Dr. S.N. Murthy. Dr. S.N. Murthy, he is not only my teacher, he is teacher to my teachers. He is 80 plus, just maybe touching 80 this year. He was trained by Dr. Venkat Rao, and then later he was taken to Jindal by Sitaram Jindal ji, who came to Hyderabad hospital at that time and quite happy with the treatment there. Then it is Dr. S.N. Murthy who helped set up Jindal hospital. Later Jindal college came up. Then he was also instrumental in influencing Shri Virendra Hegde ji to start SDM college. So he has done immense work in the field of naturopathy. Right now he is working with Pema Wellness Center in Vijnana. So it is his, we requested him, sir knows the fundamentals of naturopathy so thoroughly that you ask him anywhere to anywhere, and his diagnosis is so perfect that status asthmaticus, the condition where a patient undergo, the asthma patient will get into kind of crisis situation, and he will immediately go to patient and then start giving some acupressure points, and then or some kind of acupuncture. The patient will get relief within minutes, and it's a kind of magic he does in clinical practice. So we requested him to come here to talk to you all, but unfortunately last minute there was some emergency, he could not come. So he prepared this, so facial diagnosis, which was given by Louis Kune, and then morbid matter theory of Henry Lindlehart. They come together to make us understand body has propensity to accumulate toxins. The toxemia theory has come from J.H. Tilden. So these 3 things, first 3 things, the facial diagnosis is the outcome of morbid matter theory and the toxic theory. So toxemia, when through air or food or even thoughts, we accumulate lot of toxins in the body, and now that the latest research in medical field talks about leaky gut syndrome, have you heard? So earlier we had no clue in medical fraternity that how come there is a larvae or some parasites in the brain. How does this parasite reach brain was a big question. And you all must have seen clubbing of nails in bronchiectasis or any other chronic suppurative lung disorders. The moment lung disorder is cleared, the clubbing is gone. How nail bed has anything to do with lungs is no clue. So all this was discussed in morbid matter theory. So you accumulate anything that is to be eliminated from the body. If it is not eliminated from the body, if it remains in the body, it travels all over the body, and depending on the propensity of the organ, it gets deposited there. And they have gone to the extent of which side to sleep to avoid which encumbrance. You know, to that extent, Louis Kuhne, through his tremendous ability to observe patients, because he was such a revered man during his period, even princely people, and in those days, you know, they were all his patients. They would wait for his audience, and then he would check their neckline, jawline, and then diagnose. So that was his forte. So he would say, you have a problem of, say, left side encumbrance, you have a problem of, say, heart, and the right side encumbrance, maybe you have a problem of liver, and based on that, what all problems can come up, and he would ask also certain questions. So all these things are discussed in these books written by Louis Kuhne, Facial Diagnosis, Am I Well or Sick, and The New Science of Healing. And similarly, Henry Lindland, in his book Morbid Matter Theory, he has even Sutrikaran, you say, no? So he has simplified it in saying that unity of disease and unity of cure. That means most of the diseases occur because of presence of this morbid matter in the system, and we have 4 eliminative organs. If 4 eliminative organs, any one of them is impaired, that result in the impairment of other eliminative organs, ultimately result in lodging or keeping foreign matter or the toxins in the system. So when it remains in the system, what happens? I think this history, this is how Louis Kuhne would look like. And science of facial expression is what is given as facial diagnosis. Now, so these, a healthy man should have these 4, you know, proper excretory functions through urine, feces, and through skin, and then respiration. These are considered, according to naturopathy, the protective organs. So heart and brain are not given first importance. What are given first importance is these 4. If these 4 are active, the rest of the body will become all right all by itself. It knows to function all by itself. For some reasons, any of these are stopped, or if they are not fully proactively working, then that may accumulate foreign matter or the toxic matter in the system, and which gets further circulated, and then that will result in disease. Okay, any doubt here, particularly the youngsters, students? Have you understood this philosophy clearly? And this leaky gut syndrome, which is talking now about even microbiome. Microbiome is considered the latest in thing in research. Sir, I think we should have a microbiome lab here also. And instead of blood transfusion, now it is fusion. What is fusion means? Poo infusion, transfusion. So the bacteria that is there in our poo is more important now than, and similarly the bacteria that is there in our mouth and the bacteria that is there on our skin, and each of us is different by way of the microbiome that we have. So the science is growing that side rapidly, and giving more impetus to what we have been talking about. So if there is it's not just biochemistry that matters. Your biochemistry changes according to the microbiome. It is the microbial activity in your gut which will digest food and then give you what you require. If they are not active, if they are not working well, then there is a problem. and so much so that now even natural deliveries, where a child which comes through the natural canal will have lifetime immunity, whereas a child who is born through cesarean section may not get the same kind of microbial what I would say protection. But then based on this, what they're doing, a child is now born through cesarean section, and then a microbial film is applied which is collected from the mother's vagina. But then that is not giving the same amount of protection, because the pain is important there. So what we consider pain to be removed, painless delivery, is not good at all. You know, now they are going to that level based on this microbiome theory and research. So friends, what is from naturopathy, again I am coming back to the naturopathy perspective, the urine, you should have a free, natural, without any effort, you should be able to evacuate, and it should be amber in color. This, I think even in physiology, we all must have studied the same thing. Similarly, fecal matter, you should not think that I need this and that and that and this to go to toilet, you know. And the skin, it should be, see, it should not emit any foul smell, and it should be slightly moist but not too much of sweat. At the same time, in order to have a beautiful skin, fair and lovelies and all that we are using these days, it is neither fair nor lovely. What is happening is, it makes your skin, you know, little more less active. You know, in fact, we have to make our skin more active. We should make it perspire. And the deodorants that we are using, you know, which will not allow us to perspire, is not good, right? And we should have also such clothing which should allow us to sweat. And similar, all such things we must, you know, find out how many ways we. That's why we give steam bath, and at times we give even sauna. Sauna is even more harsher style of making skin sweat, right? In steam you have moist and heat, whereas in sauna it is dry heat. So your skin has to function well. And also the sunscreen lotions also are really not needed for Indian condition, because we have the protection of melanin pigmentation, which helps us in fact synthesize many. So everything leads to something else. That's what I said earlier also. 1 + 1 necessarily need not be 2 in biological sciences. That's what even quantum physics says. It's there, it's not there, at the same time is the current science. We have come to that level. We cannot still you know, be there at 1 + 1 = 2. And particularly naturopaths, your mind, your emotions, and your you know, all other baggages that you come with, everything has a say on the disease pattern. And respiration, and very surprisingly in Louis Kuhne books, you also find that your skin has a link to your respiratory. Your skin functions like a respiratory organ. So you perspire, you respire, and similarly in the respiratory. So anybody having asthma, you should also see if that person have had any skin lesions or any other condition where skin is not active, and vice versa. If you want to activate skin, any, say for example, psoriatic patient is coming to you, teaching pranayama may help better than just giving skin applications or lotions or treatments. So that much these two organs are linked, and all other organs are linked in the same way. So Yeah, normal figure. What we look for in a normal figure is the form, color, and the mobility. And so when you are seeing, if you are seeing the neck, because that is what we are now very crucial. This is the figure that is normal figure given by Louis Kuhne in his book. Please read that book, Facial Expression. Book is very interesting book, and we can improve upon it. That's a different thing. But then first of all, we must know what exactly was mentioned there. And this is a normal figure. Here, please look at the neck. He is more concerned about the neck portion. So what should be the size of the head and how it should be and all that he has very clearly mentioned. Anything important here I will, yeah. Yeah, these are all more or less what we, yeah. We have come to three very important demarcation points when it comes to facial diagnosis. Talks about the deposits of, it's not fat, don't think that fat deposition is deposition that we are talking about. Here it is the morbid matter ultimately. So certain areas will become prominent. You make it a habit henceforth now, whenever you see anybody, particularly suppose you are going on in car or two-wheeler or when you, there is a traffic light, traffic signal, and you stop. And then in front of you there are people and then standing. You just look at the nape of neck. You can see even very young people, here there is a bulge. For some people bulge is here, for some people bulge is below, for some people bulge is here, for some people there is a bulge on one side, for some people there is a double chin. You can see all these, and old people there are definitely changes you can see, and anybody above 6 you hardly see jawline, nape of the neck, and then thigh line the same. So this is what he systematically analyzed and then came up with his encumbrance theory. His encumbrance theory comprises of front encumbrance, side encumbrance, and back encumbrance. So front encumbrance talks about all metabolic diseases which are quite easy to handle, or even little of acute conditions which according to naturopathy we consider them good. They are cleansing processes of the body, so they are in a way good. But then side encumbrance, that to right and then left, and back encumbrance are little problematic, but side encumbrance is that way also is treatable, but back encumbrance has definitely something to do with the neurological issues. So this is some of the figures given by Louis Kuhne in his book of facial expressions. So this is front encumbrance, where you can see the double chin, and then so in the face looks enlarged and then clumsy, and even goiter like heavy neck you can see. So mostly they lead to simple conditions which are easy to cure. So these are again front encumbrance conditions. See, you can see her face here in the middle of the throat. There is a bulge. You know, for him there is a double chin. So side encumbrance is the right side and then left side encumbrance. Here the jaw line, you know, that gets obliterated completely and it becomes puffy here, and then the puffiness will continue if it is right encumbrance, and similarly if it is neck left side, and mostly you look around the face and the neck, that is the encumbrance theory. It's not that front encumbrance means tummy up and then back encumbrance means back. No, that has not much to do with the encumbrance theory. Encumbrance theory precisely talks about the face and then neck. Okay. So this is side encumbrance. You can see one-sided, the bulge. So as I told you, right side, all the organs that are there on the right side, will have a say on which side is the encumbrance. So that side of organs are affected. Accordingly, you come up with the plan of treatments, and the removal of toxins should be based on that. And particularly the kidney, spleen and heart are considered in the left-sided encumbrance. And back encumbrance, as I told you, it's more considered serious according to Louis Kuhne, and mostly neurological related issues, and very not much can be done. But when we started seeing many people with back encumbrance these days, that means depression and anxiety and many other neurological conditions might have become commonplace. And and also mixed encumbrance. Say you have left-sided encumbrance and also front encumbrance, then you can treat well accordingly. So which side of metabolic compromise is more, which can result in which encumbrance also he has gone to that extent. Whole body encumbrance, he finally comes back to the overall body encumbrance. Universal jet. So I think going back to that, so how do you deal with removing of encumbrance? He says only 3 things are good enough: hydrotherapy, barefoot walking, increasing vitality. Now, how many will agree? Only these 3 are sufficient? Yeah? How barefoot walking will improve? Reflexology. Okay. Anything else? Barefoot walking, latest. I mean, I'm looking for, from youngsters, something which has come about very recently. Earthing, oh yeah. Anybody else heard about earthing? Yeah? What does that talk about? Negative energy. So who is negative, earth or human? Yes? Yeah, see all this electricity that we have, installations that we have, they always have earthing. Why do they have earthing? Why do they have earthing? Every electrical installation, whatever you have, they have to have earthing. You know why? Yes. So earth can absorb excess charge. And similarly, human body, many human body's functions are based on electric impulses. Whether it is a heart or brain or at neurological transmission, all these things are happening based on the electrical impulses. That means we produce lot of electricity. I believe our brain produces as much as 10-watt bulb can be lit using the electricity if we can put all that together. So various functions that the brain does, whether you are awake or sleep, it's still functioning. So that much energy is continuously produced, and we are the only animal which is using footwear the way we use, which is protecting us or preventing us to have this kind of connection with the earth. So by that what happens, even birds and other aquatic animals also have some kind of connection with the earth, but then we don't have any earthing now. So this is taking us far away. So latest research says that Earth is slightly negatively charged, not fully positive or fully negative. But what happens in human body is we accumulate lot of positive charge. So +3, +4, I believe at any given time, all of us may be having. So just what needs to be done is walk on earth, and preferably moistened earth. That's why walk on green grass is better than walk on just dry. So lot of work is being done on that. So barefoot walking is one such thing. How Louis Kuhn could have talked about it, no clue, but then it was mentioned in his book that barefoot walking also helps. And increasing vitality. Now I think I'll spend little time on vitality, and then I'll wait for more discussion. So now who will tell what is vitality? Now so far we talked about encumbrance based on morbid matter theory, which is based on toxemia theory. Now other important theory for naturopathy is vitality. So your body is essentially having vitality. You have to bring that vitality to fore. So what is this vitality? Where does it, Yeah, at least first year you have completed PNC. Any one can get up? Yeah, what is vitality? How does it look like? Where does it lie? Faculty? Are you a faculty? No. Students? Okay. But how do you know whether you have vitality or not? Suppose I say, do you have good vitality? Then what comes to your mind when you hear this word vitality? You should ask this question to your PNC sir. He'll go back, prepare and come and tell you. Huh? कैसे पता चलता है? All channels, how do you know all channels are working or not? How will you see? How will you get to know? And is it more or less? Should one have more? Should one have less? What is optimum? What is optimum to him may not be optimum to her, right? Vitality, according to the theory of vitality, which is again talked a great deal by Benedict Lust, it's a given thing. You're born with certain amount of vitality. So we are all born healthy. And the genes with which we are born, we don't have to consider it sick or disease or healthy. It is your vital capacity. What is your vital capacity? Like for lungs, how we tell, like that, your vital capacity of the body is given to you at the time of birth. What at the most you will do is you draw energy from that vitality and then you replenish it. Your day-to-day activities. You cannot go more or less. You can never ever say that I will increase your vitality. You cannot do so. You can only bring it back. This we must understand. Otherwise, like these quacks, we will also be talking that I will increase your vitality. You can never increase. A qualified naturopath should never say that. Right? So, the vitality is a given thing. In normal circumstances, we are all born healthy. Health is constant. Disease is temporary. It comes and goes. But then body comes back to normal all by itself. Body is a living machine. It knows to correct itself. The systems theory talk about that every system is self-contained. It knows to organize itself. So accordingly, it makes changes here and there, but then it becomes functional within the same. So according to this, there is nothing called absolute normal and there is nothing called absolute abnormal. Understood? So there is this scientist Can Gulhem. This Can Gulhem has written this book, The Normal and the Pathological. The normal and the pathological says that he kind of was little perplexed when he saw certain tribals where their blood sugar levels were only 40 milligrams per 100 dilutions, but they are quite functional and normal. Whereas he came to London, at that level they are falling off. They are becoming dysfunctional. While they, in Londoners, they are dysfunctional, this tribe, they are quite active with the same levels. So should this be taken as normal? And should the tribals' sugar level should be increased as we are doing for the Londoners? He did not, because he is not a medical person and he was only trying to explore, he is a biochemist. So then he went on studying how this physiology and pathology came about. Then he realized that initially only physiology was there. Pathology came later, even as a subject. So what we study in pathology is only an altered physiology. Altered physiology means it is altered temporarily and then it comes back all by itself. But during that period when it is in altered state, we bracket it under pathology. And then start treating and then wanting to bring it to normal. Whether you do it or not, it comes to normal. So that's what, again, our understanding of homeostasis, what is mentioned in physiology, and we also say that health is constant. It comes back, and disease is temporary or transient. It comes for a while and then it goes back. And any other thing which remains for long, body adjusts itself to that. That's what, if you have heard Dr. B.M. Hegde, where he tells that any elderly persons, if they are having any cardiac problems, we don't have to worry so much. Why? There are these natural collaterals which opened up in heart, and the global circulation to the cardiac muscle is complete, in spite of complete blocks. It's not 80%, 60%, which is again, it's a mathematical simulated computer calculation, not in reality. So there is no meaning to it. Okay, so one step further, naturopaths coined it as like, disease does not embrace you, you embrace the disease. Okay, how do you explain this? Disease does not embrace you, you embrace disease. You embrace disease when your vitality is low. Okay. So how do you measure? I told you, no? There is a vitality questionnaire. I request Dr. Puneet Raghavendra to circulate this among all the participants. This is developed by in constant interaction with NIN faculty, one software group. They have prepared this questionnaire with which you can come about calculating a person's vitality. A person who comes to you with severe loose motions, maybe 30, 40 a day. But still, if vitality is good, if you can come up with a score of vitality, you can very well nicely treat with the simple cold packs and maybe cold enema, and the person will come back to normalcy within no time. But if vitality is poor, if the score is very poor, even after treatment, the person may not respond because the internal organs will not respond in the same way. So vitality score will be very, very important as a tool for you to assess a person's healthy response mechanism within the body. So that requires you to see the physical and physiological vitality that is spent, the environmental exposure, and because of which we spend our vitality, because vitality is the one which we draw for all our day-to-day activities, and we have to replenish again with our activities. And psychological and emotional and occupational vitality that we spend, all these put together will give out our vitality drain. The vitality drain, if it is too much and we are giving not that much, then what happens? There is a continuous drain on your vitality, and that is over in the long run, that will result in compromised response mechanism of the system. And continuous load, whether it is toxins or thought processes or environmental conditions which will drain our vitality, we have to be mindful of that and replenish it and bring back your vitality back. So this Dr. S.N. Murthy, he comes from that old school, so spent a lot of time on what we eat, when we eat, and how we eat. All that is very, very important, and in bringing our vitality to its level where it is optimal. Somebody used the word optimal here. It remains at that optimal level, and that's why some people may say, my grandfather used to smoke, but then he lived up to 100 years. And he used to walk, run. That means at one side maybe he is draining, but on the other side he is replenishing because he is walking barefoot and he is living close to nature. Perhaps that protected him. Now you live in such compromised conditions and also smoke. That means you are draining. So you have to see in how many ways your body's vital capacity is drained, and in how many ways. There is a continuous interaction of your system with the environment around. That's where we talk about harmonious vibrations. These harmonious vibrations are not established. We cannot say that we are healthy. So in order to establish these harmonious vibrations, we can even talk about interpersonal relationships also. Some people we get so allergic to. We are so irritated. We become so restless. With some people you feel very happy, very gentle, although they may be sick persons sometimes, right? So all this constantly makes us, but this requires lot of observation, and observation is the key for diagnosis, any diagnosis. And if you don't understand naturopathy fundamentals, I think you will go wrong, whether it is pulse diagnosis, whether it is energy diagnosis, which you are going to be introduced, and all other, and vitality score is another very important thing. I'll go through these questions, all of you can answer. Yeah, how much time I have now? Okay, yeah. When do you go to sleep and when do you get up? That is the first question. When it comes to physical and physiological score. See how important it is. We take sleep for granted. But not only just sleep, but then when you go to bed and when you get up is more important than just number of hours of sleep. Okay, second question is, how is your sleep quality? You go to bed immediately? And you get up easily, I mean you get disturbed easily? Or how many times you get up in your sleep? All this, you know. Then third question is, how active are you during the day? Okay, you slept well and all 10 hours, huh? But then are you active during the day? And how active are you? Then fourth question, how is your bowel movement and how is it triggered? What is the quality of the stools? Yeah, we don't discuss this, right? But toilet training is the first step a mother does to a child. Very, very important thing, and we should not feel awkward to discuss these things. In fact, that is the basis for the entire philosophy that we are talking. As I told you, large intestines is one of the eliminative organs crucial for naturopaths. Then sixth question is, what type of food do you take? Plant-based, lacto-vegetarian, ovo-vegetarian, non-vegetarian, or mostly all of the above, huh? Then seventh question, when do you tend to eat? When you are hungry or when it is time to eat? When it is served? Whenever it is available. Correct. I fully agree. So, eighth question, do you have any addictive habits? Yeah, food itself is a big addiction, and there are many other addictions. It's better we know that we are addicted to it. Daily, routinely consuming is different, and missing it is different. Becoming restless if it is not there is altogether different. Pani puri evening, tadak. So I believe many young girls are addicted to pani puri these days, and now people are wanting to study what is this actually that is there in pani puri that is making them addictive. Okay. Anyway, I do not know, so I am not young anymore that I can fall prey to this. So do you have any practice of physical workout? Are you physically active and you do any physical workout every day? And if you are a woman, and that too in fertile span, how regular is your menstrual cycles? So these are 10 questions which tell about your physical and physiological health. And if you get a score for that, depending on that, you have to analyze the vitality. Then environmental exposures spend. What kind of environment are you in most part of the day? This is the 11th question. Whether in AC conditions like this or out and open, that kind of thing. Environmental means that. And how exposed are you to sun? We are fully clothed, and then how much are we, even if you are in sun, how much are you exposed? What type of water do you drink? Yeah, mineral water, RO water, bottled water. Okay, now I think there are some of the activities which will tell how connected are we to the nature. I think based on this alone, we can have a future career, built upon. Do you do one or more of these practices? One, barefoot walking, lying on earth, sleeping on the earth, gardening and with bare hands, hugging a living tree, lean against or sit near a living tree, swimming in the streams or lakes or rivers, moon gazing, bird watching. Oh yeah, not bad. All right, so these are some of the activities which we are completely thinking that they are not part of us, but they are all part of human activity. It's there, all of. Oh, but they said just now. Okay, looks like you will be shared with this questionnaire.
We have shared in your WhatsApp group. Just to open that.
Yeah. So you, all of you today by evening go back, and then in the end you have this interpreting the results. How to interpret the results also is there in that document.
So we have shared that 54-page book. The question of which ma'am is addressing is in the last 4 pages, including the results and the interpretation also.
Yeah, this is a basis for all your talks today and tomorrow. Please pay some attention and then analyze yourself, and then see where do you have with regard to your vitality score. Each one of us should do that periodically and then see that it is improved. Came on. Anyway, I don't require this. Yeah. So I will end here, and I want you to spend some time on all these aspects, and microbiome and is going to be the future, I think very close to naturopathy connected activity. So anybody interested, please spend some time on that. And alternative diagnostic methods involve molecular and functional imaging, AI machine and nanotechnology, and genetic testing. Recently, I think Dr. Roshita, you were there in Dubai recently in the conference, second International Naturopathy Conference. There was one lady who was talking about genetic engineering and using it. Again, she is not using it, bringing genes into our body or anything. Using that as a tool, she's all trying to tell us what kind of health problems you may come across. So you better start practicing these lifestyle modifications. Ultimately, it is coming back to naturopathy only. It's a lifestyle management, but then using genetic mapping as the basis for her, it's a career, and she is completely MBBS MD person. So this kind of, they are completely changing their profession and then adapting naturopathy principles into their practice. And while we are thinking that we are somewhere, lagging behind and science is not on our side. In fact, we are more scientific, because naturopathy, there is nothing which cannot be explained. There is nothing which cannot be explained. It is straightforward. And there are many things. Say, for example, paracetamol, if it is given to 2 individuals, 500 mg, how can you explain? He is 80 kgs and she is 48 kgs. How can 500 mg be working same in both? Is there science? Is it scientific? That is not scientific. Whereas it is scientific if you give 1 glass of water for both, because she may excrete more and he will excrete less, and then but both will get benefited by the same amount, even if it is given as same amount. Because since body is an organic functional thing, how much is required and then body can take and then the rest can be eliminated. and body's mechanisms are more important for us than the external inputs. To understand this, you have to continuously experiment on yourself, which you can easily do. First, one day you will understand what all changes occurs. First 2 days, now you will know. Now third day, fourth day, fifth day, sixth day, seventh day, unless you experience it yourself, you cannot tell patient with the same amount of confidence, same amount of strength, which patient will be able to do it, and they will do whatever you say. That's why a naturopathy doctor will not remain as a naturopathy doctor, but a naturopathy doctor will become a friend later, become a family member, and later you become a philosopher and mentor for the entire family. That's what happens with us. And you ask any senior naturopath, this they will vouch for. So that's how it becomes. Because we can tell about everything that they do. We don't have to interfere. But then when they ask, we should tell it with so much of sincerity and confidence, which comes from your practice, your understanding, your experience. Everything that you are telling, you can also experience. Right? So I stop here, but anybody really keen on research can collaborate with YENEPOYA also. There are also startups and all that he's talking about. I think all of you, there are so many areas, gray areas, and you can think of thermoregulators to our tub baths, and then you know, like this. Recently one lady had come to NIN with pillows and doormats kind of stuff, which will bring about the same kind of earthing mechanism. And so whatever that discharge that has to happen from the body, these plates will do it. So people are coming up with beautiful ideas, and like how people have come about during COVID time. We all started seeing using oximeters, the oxygen concentration in blood. Maybe you can come up with some tools to diagnose toxic load. You can come up with the tools to understand the microbiome on the skin, microbiome in the oral cavity, microbiome in gut, right? So there is so much to do, because we are still not that way techy. We are less technologically advanced system, hence there is lot of scope. Yeah. Thank you. I'll stop here, and you want to ask anything, you can ask, and any controversies you want to discuss, anything that you feel inappropriate or not syncing with the science. Yeah. Yes, please.
Ma'am, you told about that everyone is having different optimal level of the vitality. So how this questionnaire will be assessing the everyone's optimal level of vitality? Like the person who is aged and a person who is like in his adulthood. So both the people will go through the same questionnaire. So how we will assess the optimal level in it?
Yeah, that's a very interesting question. You go through the questionnaire, you will understand. Because if you do it now and do it after 5 days, your score is different. So it changes. Since it changes from person to person, the score also changes from person to person. That becomes optimal to that person. Since it is not the same, hence it is optimal to each individual. So it is not like measuring and then making all others equal, like how we are doing it. And there also, even in physiology, we have ranges, right? But here there is no range. Here also there is a range. You ultimately come up with that range. In the end, in the interpretation, if you see, that's why I'm telling today evening you go back and then all of you see here a range is given. Above 70, you are on the right path. Between 50 and then 70, you need little changes here and there to make it to optimize your vitality spend. 35 to 50. So like that score is given for each aspect. Each aspect means that physical and physiological, environmental and emotional, psychological. So it varies from person to person. For the same person also at different times your score will be different. It cannot be the same. It should not be the same. That's what we are saying. It is good for that person at that time which is optimally taken. But ultimately, what is absolute? There is nothing called absolute. But it is optimal for that person at that time. If it is too much of a drain on that person, then it is very difficult that our interventions will be working. So you may be running into a risk. So you never know you are dealing with a risky person or a person who will recover. So this score will help you there. It will protect you. See, I will give you the example of my father. My father had triple vessel disease at the age of, I think he was 73 or 72. And he was advised immediate surgery by almost all cardiologists that I could go to in Hyderabad. At least 7 or 8 people I must have consulted. So finally, we have decided to go ahead with it. While he was pestering, I will undergo naturopathy and all that. So I was a little skeptical. So I came back, applied for leave, and my secretary at that time said, we are telling to so many people when it comes to our own family members, we are so vulnerable. No, you bring your father, we will treat him. My father also was asking. Here my mentor also is saying he will treat. So I brought my father to NATUROPATHY hospital. The moment he saw, checked everything, he said, his vitality is very good, no problem, he will respond. I was a little stunned, because he was having nocturnal angina pectoria. That every night he would get up and sleep with pain in the chest. That 10 steps he would walk and then he would get chest pain. And how the hell he is saying his vitality is good. Then by third day, all night pains have gone. By 1 week, he was walking a full stretch in the hospital, in Hyderabad hospital. And by third week, 3 rounds, that is 3 kilometers, he was walking with a. He lived after that for 17 years without any support, and 4 floors he could easily climb. So that is the, so it comes with that confidence if you are able to assess the vitality. So all other parameters are good. His skin is good. He is completely teetotaler, never smoked and all. So he checked all those and he said, yes, I can treat. So you should assess where is the drain. If only that is cleared, the rest will happen automatically. That's the beauty. So at the age of 88, he passed away and without much of suffering and never had to undergo surgery. A diagnosed triple vessel disease case. Yeah. So otherwise, a young person with triple vessel, if you take and this fellow, his vitals are very poor, not vitals, vitality. It's very poor. Then I think you may run into a risk taking that case. So you have to be careful for that you require to take so many inputs, whether his bowels are regular, whether his other things are regular, whether he is stressed and emotional and all those things, and how often he is under stress. Yeah. And I would like to know from you all, I think we may have a session on that. So what exactly you feel is not provided through naturopathy training or in the course, or you feel little deprived or not feel equal, if at all. One should not feel equal, we are not equal. I am quite happy to say that all other systems are one side, we are on one side. Because all others think that external support is needed, and we are on this side where we think that the support should come from within. So we are different. So I am okay to say that we are different and we have to remain different. But from your side, what do you think? You feel happy about it and take pride in that? All naturopaths did. So that's why naturopaths are little cranky people. Yeah. Huh? At the age of 84, McFadden. Have you heard McFadden's name? How many? No. Okay, McFadden was one naturopathy cranky fellow who wrote 8 volumes of physical topathy. Physical topathy. By doing physical exercise, you can treat all diseases. That was his expertise. And at the age of 84, he parachuted himself down and gave a demonstration in Paris. So you call him mad or not? And there is another guy who did a lot of work on fasting. Who was the one who did work on fasting in United States? He wrote a book also. Yeah. Backbenchers. Herbert Shelton. Herbert Shelton contested for American presidential elections. He stood for the president post of America, and hygiene movement, it is known as hygiene movement. Hygiene movement was that strong in US. And J.H. Kellogg, the book you read for hydrotherapy, in fact Kellogg's foods have become world famous now. And he was a naturopath. And they had a lot of court cases to have that name tag, Kellogg's. And he was the one who introduced cereal to American diet, who were eating only ham. Ham means meat. So he added burger, and that was, how cereal was added to the hamburger came later. So we have so many things to take pride. And Indian naturopaths, we have added yoga to naturopathy. And it happened in 1920 through a resolution where Morarji Desai was there in that meeting heading, wherein they have introduced the curriculum of yoga to be taught to all naturopathy students, whoever. So in those days, naturopathy was taught in a different way. Then of course later case sheet methods have come, inpatient methods, and then registering. All these have come. Now we have become a system of medicine in India, a recognized system. But then there were all these struggles in the past. We must understand, and then anything, completely ignoring it, we cannot progress. That's what is happening. Should take pride means then we should understand we are not same. We should not feel that what they have we should have. No, they have it because they're doing business where we are doing service. Okay. So stand from that and then feel proud, and if you're not, and if this is not giving you that kind of confidence that you can change people's life and give them better health and better kick and better everything, then it is not worth pursuing. You better go and do anything else. Anything else is worth if this is not worth. There cannot be a better thing than this. This much I can tell. That's why so many people, so many messages these days you get on food related, water related, this, that, and about fasting. Everybody is talking. Why? You can engage with anybody when it comes to health. So keep doing it, and for that, first of all, you should feel fully convinced that this is a beautiful science and it is giving you so many tools, so many ways you can offer your services to people. You can there cannot be a better thing that you really can do. And you can be a good creative writer, you can be a theater artist, it can provide a platform for anything to anything. Naturopathy is not just a medicine to practice, sit and then put your board and then start issuing slips. No, it's a way of life. It's a way of life. That's why you read this book, Adolf Juss. He talks about anything under the sun, including furniture, including what is to be done with the dead, what you should do with the dead. Should this dead body be burned or buried? Which is natural way? He writes almost one chapter on that. Which is the correct way? Burying, burning. But then you burn quite a bit of logs along with that. So you put it through the prism of natural, Natural is simply wrap it in cotton cloth and then bury it in the ground, over. It gets easily absorbed into the soil. That's what he finally concluded. Putting in the casket, he comes from during a period where, and from a land where Christian, Catholic, church was so prominent and dominant, and he talked in those days. And being a Catholic Christian, practicing Catholic Christian, it's not non-practicing Catholic Christian. He mentions all this. I am a practicing Catholic Christian, yet I tell that this is the best way. And he also talked about vegetarianism and why vegetarianism is the answer for the humanity. From taking it from New Testament, he is not talking from Vedas or this and that. And in Vedas it was not, those who talk about Vedas, it is not mentioned in Vedas to be vegetarian, for that matter. So we don't know, we are actually confused with various in between talks. Go to the original and then find, and you will find answers for naturopathy. That's when Gandhiji became immensely influenced by Adolf Juss' book. What is that book? Title? Return to Nature? Full. There is one more line below. Return to Nature looks big. The paradise regained. Why should you return? To regain paradise. So paradise can be regained because we are introduced to this kind of hell. So you regain your paradise by adopting naturopathy way of life or by returning to nature. That's a beautiful book, small book. Go through this. They have gone through tremendous resistance, but then they withstood. Henry Lindlehard and then Benedict Lust, who went from Germany to America, that war-torn days, 1900 to 1940, 2 world wars have come. It's important for us to know all these things. Now we are in a democracy, we have no big deal. But then they were in such circumstances, they went to America, they were suspects. People were making fun of them. You mean to say, with water you will cure diseases? And there's dozens of FBI agents, coming as their patients and then watching them keenly and then putting cases against them. And then they had to go through all that and then still stuck to this philosophy because it has convinced them that there cannot be a better thing to pursue in this life. That's the beauty. So that will inspire you. Why I am telling is to read these books, you know, you will never think that you have not come to the right course. If you have gone to any other course, you would have repented at one time. There are so many people who have done medicine and gone to civil services, and there are so many IITians who have gone to some other activities. But naturopathy is a lifelong activity. Whether you do it or you practice it or not with a label or board, but you can still pursue, you can still advise people something better, and it will transform you internally, right? Yeah, thank you so much, and I am hopeful that these sessions will take you to the right frame of mind in analyzing and listening to patients and advising them properly, because as I told you, that will at least tell us where exactly is the patient, how much good you can still do. There are people who have given enemas even to a comatose patient. So it's possible that if you understand vitality, you can deal at any stage. If you don't understand, even a simple case become a problematic case for you. Okay? Thank you.
Yes, ma'am. It was a very interesting and informative session, ma'am. And thank you so much for motivating our buddy naturopath. So now I request our beloved principal, Dr. Puneet Raghavendra, so to hand over the book as a token of gratitude to Dr. K. Satyalakshmi. Thank you, sir. Now is the time for lunch break. Please assemble here at sharp 1:30. Thank you all.
Hello. Yeah. Dear students, good afternoon. So I have we had one discussions with the ma'am this regarding. We want to discuss few points about what are the lacunae in the academics in the naturopathy, one of the major. So that's how we have been framed this today's a workshop mainly into the what are the lacunae we are finding in the colleges. So in order to fulfill that lacunae we have been framed. So do we need to have such a short discussions within a 20 minutes in the evening? So do we need to have or not? That is the first question. So if it is the, yeah, you wanted to discuss with the director, fine. So, ma'am, students, they want, they have to have
No, they will simply say, but then ask them to give questions. And
okay, based on that, okay.
So based on how many questions you responsibly receive, then only
Sure, I think, yeah. I think we can discuss that within ourselves then. Okay, sure. So, what we can do, so individually we can write up your questions. You can send to either to me or any one single number. To me itself, you can share that all in details. We'll compile that and we will come back to you. Okay? Sure. Thank you.
Hello. Hello, check. Hello, check, mic check.
A very good afternoon. We'll begin the session very shortly. Please assemble and maintain the silence. A very good afternoon. Afternoon first session is by Dr. M. Kalpana Devi. She'll be dealing with the topic pulse diagnosis. So about the ma'am. Ma'am is specialized in the field of acupuncture and energy medicine. Ma'am completed Bachelor of Naturopathy and Yogic Science from JSS Institute of Naturopathy and Yogic Sciences, Coimbatore, Tamil Nadu in the year 2009. MBA in Human Resource Management in the year 2011. MS in Psychology from University of Madras, Chennai, Tamil Nadu in the year 2013. Ma'am completed MD in Acupuncture and Energy Medicine from Government of Naturopathy and Yoga Medical College and Hospital, Tamil Nadu in the year 2018. Presently pursuing fellowship in research methodology from National Institute of Naturopathy, Pune in the year 2023. Ma'am received third prize in the oral presentation at International Conference on Holistic Wellness through Yoga and Naturopathy. Ma'am conducted original research studies and published several scientific papers. Ma'am, over to you, ma'am.
Hello. Is it audible? Till last? No. Is it audible now? I can hear some no. Yes? Yes. Okay. Maybe you can keep it little down. Yeah, you can. Now, let's see. Is it audible? Yes? Till last? Yes. So, how are you all? So, very happy, pleasant to meet you all. And being like I have been student, so after lunch it's a time to sleep. Yes. So let us try to make the session interactive. Okay. So I need your cooperation, and if at all you have any doubts or you feel any sort of like it's not clear or bit vague, you can just raise your hand and ask. But otherwise, we'll try to, sir have given me time till 3 o'clock, so we'll try to wind up before that. Okay. So just before getting into the session, I want to ask you all, what is your expectation from this? After this session, I should know this, or I'm expecting this. Obviously, you would have come with some expectation, right? From different parts. You don't come just to spend your time. So what is your expectation? Sorry? Practical knowledge? Yeah, that's fine. You learn some theory, you learn some practical things, but what do you expect? To see pulse or get to diagnose patient, and what are you going to diagnose? Is there some kind of expectation? No? Now you can try to be active. Everyone had good lunch? Yes. So let's see. It is okay. So, yeah. So she is my guru. So why I am just displaying is that now she is no more now. She is Dr. late Himeshwari ma'am. So without her, this knowledge would have never come to me. Before meeting her in my life, acupuncture was just pricking needles, Anton Jayasuriya, or the clinical acupuncture book which every one of us used during our BNYS session. So I really want to get her blessings every time before my sessions. Yeah. So let us go to the session now. So what do you think? We are not able to go into the pulse diagnosis so deep. We have heard of many people, like rarely we would say a very senior person somewhere. He is very expert in pulse, and pulse is something which is like only experienced people can see or can learn, and sometimes we say that person is quite experienced. He can just hold the hand and say everything, right? You need not take the notes. I hope this presentation would be shared to you, okay? Because once we take notes now, we just focus on that. So we may miss something or we may fall asleep. So what I feel is, these are some obstacles in learning, okay? So one is like inadequate endowment, like simple. Let us, instead of going one by one, I would say, so first of all, clear your mind, like I cannot see this, I need some special powers. No, it is the science, we all can do it. It just depends on your practice. It is not like today I learned, yes, from tomorrow I can do it. So you keep practicing morning, night, afternoon, every time. So I would say you even check on yourself, your mother, your father, or your sister, your husband, wife, anyone. Okay. So it is not something very high level of science which only some yogis or someone can do. Every one of us can do, because every one of us are into proper stream of education, right? For 5.5 years, we have all gone through a lot of medical subjects. And one is like, we feel by checking pulse you can read everything, because I can see the expectation of some students, some doctors, where they feel like if I knew pulse diagnosis, I can ignore everything else. I can just put off all the other things and only go through that. This is not like that, okay? And there is a difference. Everyone can hear me, right? Yes. And there is a difference between the Ayurvedic or the traditional Vata Pitta Kapha pulse diagnosis and the one which we are going to go through now, okay? So Vata Pitta Kapha, all of us have heard one or the other point of time. We catch hold and we see, yes, Vata is dominant, Pitta is like this, there is some proper ratio. So here it's not so, okay? It is completely different from that. So what my expectation from you is like, keep your mind totally blank. If anybody of here, like how many of you knew acupuncture very well? You can just raise your hands. I knew acupuncture, I knew to needle, I know the theories. I will not ask any questions. So now you can raise your hands. 100% I won't ask any questions. Okay. So how many of you have heard about constructive theories, destructive theories? Only few, not everyone. Definitely we all have heard about it, right? So today we are going to get into all these things, okay? Just keeping with that, what are you going to learn? And I feel this is not being taught to others, and the way the things are taught, sometimes it's like, now I would not say I am very much expert. I am still learning every day. So I cannot say, when I say something, I can answer this, I can answer this, I knew that, I knew that. So it's a process of learning, and you need to remember that at each point of your day. Okay. So what are we going to get? What are the take-home things for today's class? So techniques of pulse reading, obviously you should know that. Then before getting into the abnormal thing or the what is the diagnosis, disease, we are going to see how a normal pulse should be, okay? And then basic positions like Vata, Pitta, Kapha, there are some stable positions for our TCM pulse. And then you'll see the placement of fingers, how to place your fingers, where to place, how to start. And then we'll see the basic pulse images, and then what are 5 elements, then how to select the point based on your pulse reading, okay? And then again final recap of what all you should consider during a pulse diagnosis, okay? So you all have heard of TCM, right? At least heard TCM, yes. So can any one of you say what you think of TCM? When you hear TCM, what you think? What you feel? Sorry? Balancing. Sorry. Actually, TCM, when you go through it completely, it is a similar system like our naturopathy. We call it naturopathy, and there it is a traditional Chinese medicine. So acupuncture is not the only part in TCM. TCM is the entire science, okay? So they have the physiology, pathology, there are some endogenic, exogenic factors which are going to cause a disease, and how the syndromes are differentiated. So a lot of things are there in that. And acupuncture is one part of it, one single therapy from TCM. They have herbal medicines, they have massage. So instead of our yoga, they do Tai Chi. So it is naturopathy. So now this pulse diagnosis, yes, I am going to say you about the selection of points, but when you learn TCM as a whole, so it will be easy for you to prescribe. So I feel diagnosis is important to prescribe the treatments, not just to understand the patients. And how many of you feel that even our science diagnosis is equally important as a modern science? Like ultrasonography is important, yes, and the microscopic examination, blood parameters. So how do you feel our diagnosis is equally important? Do you feel it is required? Why do you feel so? Yes, of course, he is very right. Our philosophy is different from modern science. Our way of looking towards a disease or a patient, we look to the patient, right? We don't see hypertension, diabetes, we see a patient. Excuse me. So for that, our way of diagnosis is very, very, very important for you to prescribe a treatment. Because we have hip bath, we have many water therapies. But then can any one of you say, if I give cold hip bath for digestive problem to all the patients, it is going to treat the same way? No, you must have experienced it. So students, you will experience, or in your clinical visits, you would have experienced it. Same treatment, same condition, but for each patient there is a different reaction. For some patient, cold hip bath works wonder. For some, it doesn't work at all. So that is where we need our way of diagnosis, where you can exactly see what is the condition of the patient and what treatment should be given. Okay. So now let us jump to the techniques of pulse examination. So when coming to a pulse diagnosis, I need one volunteer here. Any one of you can come here. Any one of you can come here. No questions asked, promise. Yep, you can come. We are always worried of questions, right? Viva, examinations, questions, examinations. Can you take one more chair? Can everyone see us? We'll keep it on the stage. Yeah. Just face this. You can sit. Sit down. Your name? Nishya. Yeah. So let us start. See, the preferable time for pulse reading is morning, as soon as you wake up, as soon as a patient is waking up. But then this is possible only in the inpatient setup. Okay. So if any of you feel like I have only OPD, then at any time of the day patient is with you, you can go for pulse reading. But then you will have to keep in your mind certain factors which we will be seeing in the next slides. Okay. And now the main important thing in our pulse examination is the position of the, now let us say her patient. Okay. So she will be a patient. So her position should be as comfortable as the position of the doctor. So if I am going to examine her pulse, okay, so you should always face the patient. It's not like you're sitting and you're casually holding and seeing. No, you should always face the patient, okay, and make sure she is very comfortable. She or he or patient should be comfortably sitting. Ask them sit comfortably, relax, and don't let your patient support the elbow like this. Don't let them don't lean and just keep the hands out. Okay. And so here I am going to check the pulse of both the hands, because how many meridians we have in acupuncture? 12. So basically we have 5 elements. I think every one of you knew that. Yes, fire, earth, metal, water and wood. Yes, so fire, earth, metal, water and wood. Okay. So in these 5 elements we have 12 meridians. We need anytime don't call it organs. Okay. even though it is named after the organs, but then don't say it organs, it's the energy channel or meridian, anything. Okay, so we have 12 energy channels, so which is all 12. Can we name that? Like fire, there are 2, major and minor. You have heart and small intestine, pericardium, triple warmer. Then in earth, stomach and spleen, metal, lungs and large intestine. Then water, wood. That's it. So everyone are well aware of it. So we have 12 energy channels, and you are going to check all the 12. Okay. So now the position of the patient is this, and the position of the doctor is this. Both are equally comfortable. I am going to take her right hand with my left and check her left hand pulse with my right. So this is I cannot check like this. I cannot check like this. Okay. And always remember, see, this is not the right way. Okay. So I am going to check like this. Okay. So this is a way I am going to hold the patient's hand one by one, or like I will say you that. And then how must be the breathing of the patient? Relaxed and normal. Why I am saying this? See, right now every one of us have had lunch. So this will have an impact on the patient's pulse. That is obvious, we knew, right? It will have some changes even in blood pressure. So that will have a change even in the pulse rating of the 5 element. So the breathing should not be so fast or palpitating. If the patient is already anxious, let them relax. Let them take few rounds of deep breathing, make them relax. It hardly takes 2 minutes. And then try to check the pulse. And then the finger placement is equally important. I'll come to that. And then the duration of examination. So how do you feel? The duration is important. Should you check it fast, or you should take your time? Take time. So how long? Sorry? I heard 1. It's 1 hour or 1 minute. 1 minute? Okay. So I take sometimes 3 to 4 minutes also. Sometimes it happens. You can take even 5 minutes, because this is not going to hurt your patient. When compared to the tongue diagnosis, it's very difficult. You should take only few seconds to examine the tongue. But here you can take time, because when it comes to the TCM pulse diagnosis, you must be very clear of what I felt in the metal element, what I felt when I was checking my major fire element. Okay. So in this part you should be very, very confident and clear. And consistency here, I wanted to mean that today you are in the session, you are very enthusiastic, excited, today evening you check, tomorrow morning you check. But once you get back, everyone become busy in one or the other things, right? So this week probably you keep checking, next week you try, you feel like, array, what is this? Well, I cannot remember, I keep forgetting. Then the next day, for example, today is Monday. Next Monday you may feel like this is a bit vague, I cannot feel only. I am not able to feel the levels only. What should I check? What should I note? I am not having time. So then it will slowly fade off. Your practice also goes down. Then you cannot master this. If you need to master this, consistency is very, very important. You should keep on checking your pulse. Start with your own pulse. Right. After this class, while listening to any sessions, try to check your own pulse. That will help you in any time. But once you stop practicing it, definitely this is going to be difficult, because I believe we all practice yoga at least 3 to 4 times in a week, if not every day. So your focus will be much better when compared to anyone else. Okay. So here focus is very, very important, and your mindset is very important. You must be very calm and composed, stable. If you are tensed, if you are anxious as a doctor, if you are into some kind of stress, then your pulse reading will not turn out properly. So you need to calm down yourself and then ask your patient to calm down. Okay, so your mental state and your position is most important, and then only comes the patient. Okay, so before this, yeah, so I'll just say this so that she can even go there and comfortably sit. She'll be a bit tensed. So see, when I said Vata Pitta Kapha, we have the habit of placing all the 3 fingers, right? So here we are not going to place all the 3 fingers simultaneously. We will be using only this. So you can see picture A, right? So likewise, I am going to place only my 1 finger on her styloid process. The basic key position to start the pulse reading is palpate for the styloid process and place your finger onto it. Everyone can just check like this. Every one of you can do. Okay. So when you place it over the styloid process, that is the center pulse in any of the hand, if you are checking your right or left. Okay. And always remember, don't cross. Come from your radial side. Check the pulse from the radius. So if you are checking on yourself, it should be like this, not like this. See, don't go like this. Come from this end. Check like this. Okay. So now I am going to place like this. Okay. See, you may feel I am sitting. I am very much comfortable in my position. My back is also straight. She might be a bit nervous, or she must be relaxed. You want water? Okay. So now you will have to place your index finger on the styloid process, that is the center pulse. Okay. We have 3 pulse position in each hand. Okay. So in the left hand there are 3 pulse positions, and in right we have 3. So now I am checking her left over the styloid process center, that is the middle pulse center. Okay. And then just next to it. So you can see here, this is her styloid process, this is her center pulse, and then here you can see the wrist crease, and just near to it is a distal one, and after the middle pulse is the proximal one. So for your convenience, you can name it 1, 2, 3. Okay. Because finally we are going to remember the element or the meridians, or not 1, 2, 3. So now for learning the pulse position, this is the center, this is the distal, and this is proximal. So there is no matchstick difference, there is no 1 centimeter, 1 millimeter difference between the 2 pulses. Okay. So why we should not keep 3 fingers, and why I am keeping only 1? Because for the proper understanding of the pulse, because not all patients are of same size. Okay. So, and not all doctors are of same size. So when you keep your finger 1 by 1, it is easy for you to understand the pulse image. Okay. So this way you are going to check. Start from the middle always. Remember, this key starts from the center one always. Okay. I will say it why. Even you can feel it. So these are 3, the center, proximal, and distal. Near to the wrist crease is the distal one for now. Okay. So here this is, thank you doctor. Thank you. So the image B is a wrong way of checking the TCM pulse. Okay. Always use only your index finger. Always use your index finger and check the pulse 1 by 1, not like this. Okay. So here, can you see all the 12 meridians? Yes? This will be shared with you. So you use your camera to see. Don't use your mobile cameras. Use this camera and you can capture pictures in your eyes. This will be shared and it's very freely available on Google. Nowadays everything is available on Google, so don't click. Okay. So see, this is your right and that is the left. Okay. So instead of turning there, I am showing with my right hand. I said there are 3 pulses: center, distal and proximal, right? So let us start from the center. This is the earth element. Okay, this is the earth element. Okay, your right hand center pulse is earth element. So the superficial is yang, which is stomach, and deep is yin. What is in? In earth element? Spleen. Okay. See, yin and yang organs is a superficial and deep organs. Now what I want is, every one of you try checking your earth element. Just place your finger, as I said, just place your finger, touch your skin. Don't press, don't give any pressure, just touch. So can you feel any pulsations there? Yes? Because we all have had our proper, very tasty meals. So everyone will feel the pulse prominently at this position now. Okay. So this is the superficial pulse and this is the earth element, which is the stomach on the superficial, and deep it is spleen. Okay. And the distal is the metal. So metal element, superficial it is, always remember the superficial is yang meridians and deep layer is yin. Okay. So this is the only thing you will have to remember here lifelong. Okay. Every time we will not keep checking it. Only today you try to by heart it. Okay. So take this is earth, here it is metal. So metal superficial is large intestine and deep lung, and here it is your minor fire. Okay. So minor fire, what comes superficial? Triple warmer. You can say it aloud, it's right, no wrong in that. And the deep is pericardium. So can you repeat with me? The center pulse in right hand is earth, and the distal one is metal, and the proximal is minor fire. Okay, we have 2 fire, major and minor. In right hand we have the minor fire pulse in this position, right? And now coming to your left hand, the center one is wood. So superficial it is gallbladder and deep it is liver, and near to your wrist crease is a major fire. So what are all the meridians in major fire? Heart and small intestine, and here you have your water element. Okay. So what is the center pulse in your right? Earth element, and in your left wood. Okay. So now let us go here. So now you can see this image. So here you can see superficial is large intestine, stomach and triple warmer or Sanjiao, triple heater, whatever you call it. Okay. And the deep is lung, spleen and pericardium. Okay. And there goes your small intestine, gallbladder and urinary bladder, and the deep goes as heart, liver and kidney, right? Only this thing is a primary step which you will have to remember. So what is the easy method to remember this? Whenever you say place your finger, say this is earth. Place your finger, say this is metal. Place your finger and say this is your minor fire. So in this way you might feel very silly, but this way you never forget. Okay, because your fingers goes there, even in your sleep you will say, ah, this is minor fire, this is metal, this is your stomach, spleen. Okay, right? Now you know how to place your finger. So you are going to use 3 fingers? Yes? No? So how many fingers are you going to use? Yeah, sure? Which finger? Sure about it? Why should we not use 3? See, think about a baby or a kid of 11 or 12 years and think about a patient who is obese who is 40 years. Okay, so if I am going to place my 3 fingers to the baby, it may go far away from the areas. Maybe the baby is too thin, or even if the baby is obese, but then our finger and the baby's hand would be, the sizes would be like, you will not feel your middle pulse you are placing like this, right? I said the middle pulse is over the styloid process, but it may go beyond styloid process. So always do only with your index finger, place it one by one. Okay, so every time you will be using only one finger to read all the 12 positions. Okay, fine. Yeah. So how should be a normal pulse? As I said, there is no ratio here, no 3:2:1 or 4:2:1. Okay, so here I was speaking about constructive cycle, right? So this is a cycle. So when you check all the 12, it should be in the same rhythm, right? So how to check? We all have seen our middle pulse, right? So now when you touch, see, I am touching it. This is a superficial, and when I am pressing it, this is a deep. So you all can just place your finger on the earth element. We have checked our stomach pulse, right? Now try to press your finger and see if you can feel any change from the first superficial layer. So first try to focus your superficial pulse. You are feeling something. Now slowly press your finger, go to the deep layer and see, you will feel a change from the superficial to deep. Are you able to feel? How many of you cannot feel? If nobody is raising the hand, then I am sure half of us are into sleep. Only 2. So this just depends on our focus. Okay, so start feeling your pulse. First of all, our fingers should be sensitized for it, because maybe as a doctor, every time we don't check pulse only, because there are digital apparatus for BP which is showing the pulse rate. So we are used for the modern equipments. So that is a simple reason why we are not able to feel it. But then you can feel. But I feel everyone can understand the superficial part. Can you feel it? So now try to slowly press. Can you feel? Yes? No? So if it is no, still not a problem, keep checking it. Okay, as I said, consistency is a key. You keep on reading your pulse after your meals, after your sleep, before your sleep, after you wake up. Okay, so when you touch, it is superficial, and when you go inside, press and deep. So one small trick I can say here is, so as a very beginner for pulse diagnosis, what you can do is place your finger into one proper position, give complete pressure where you feel no pulse. So there is one spot when you give lot of pressure, we don't feel any pulse. And from there slowly release your finger. Now what you feel is a deep pulse. Are you feeling it now? Everyone? So this you can try it on yourself at different time of the day. Give full pressure, there will be zero feeling, and then slowly release it. You will feel a pulsation, that is your deep pulse, and then slowly release furthermore and come to the superficial layer where you are just touching the skin. So there is a thin wall between this deep and superficial. How many of you are able to feel it? Two different pulse in one position. Raise like this with full confidence. Yeah, good. So those who are not able to feel, don't feel like it is not for you. Maybe today you are not able to feel, maybe now you are not able to feel. Maybe by the time I finish the class you will be able to appreciate all the 12. Okay, it is just with the sensitization of our fingers. So what is a normal pulse? First thing is, everyone can feel it, feel all the 12 beats properly. Okay, so that is one clue for a normal pulse, and it is regular as we see the heart rate, and it is not skipped beat or missed pulse, nothing is there, it's regular, not interrupted, and it is not too deep or not too much. Like sometimes imagine after you exercise, like after you do 12 rounds of Surya Namaskar, how is your pulse? You touch and you feel a throbbing nature, right? So it is not like that. That is, after your exercise you have a pounding nature. So that is not the normal pulse. Normal pulse is you keep your hand and you feel a very soft rhythmic pulse. Okay, and it is felt clear both in superficial and in deep. It is not that I feel only superficial one and not deep. Okay, and let us forget the number 72, 64 and all. For one breath, you should feel at least 4 beats. For one inhalation and exhalation, you should feel at least 4 beats. Okay, so a patient may have 20 inhalation and exhalation. It means for them it is 20 into 4. For patient whose breathing is breath rate is very less, like say 12 or 14, for them the pulse rate is down. So for one inhalation and exhalation, you should count 4 beats, right? Yes? So leave this 64, 90, 72 and all. And in Chinese term, the normal is pink and the normal is Bing Mai. Mai is a common term, pulse. So ping is normal and Bing is deceased. Okay. So these are some vague, dry parts in this pulse diagnosis, but still we must be knowing it. So this you know, this we have seen. Okay. Let us go to this. So are you aware of this? Yes. So what you understand from this? Constructive and destructive cycle. But how are we going to use this in our point selection? Sorry? Tonification and sedation. Okay. So here you see some arrow marks. Just leave this for now. Okay. We learn the basic generating cycle. Okay. And then we learn how to use the points. So after the class, after today's all sessions are completed, you can download, or even we will send you a PDF of list of command points. There is a list of 60 command points. That is a first step where you can start pricking needles based on your pulse analysis. Okay. So pulse reading is something what I can say, in the starting I said, right, TCM is like naturopathy, it's an entire system. So you need to understand the physiology of all these things. Okay. So for example, fire. So here you have only the major fire is listed, you have minor and major fire. If the functioning of the fire element is proper, then your earth element can function well. Okay? If this is proper, then your metal can function well. So likewise this cycle goes on. So energy is transmitted from fire to the earth element, from here to the metal, from metal to water. So when this is a cycle, okay, so when we say only the order, it will be difficult. So that's why maybe the Chinese have termed here mother and son, or mother and child. So here if fire is a mother, earth is a child. But then earth is a mother, then metal is a child. So each element is a mother and child of its corresponding organs. You must remember this cycle. Okay. So when you remember this, so now we'll go to how to read the pulse. So after reading the pulse, you will see one element is dominated and one is very deficient or less. So there you pick out those two elements and see where they are placed in this 5 element, and then you send energy. For example, if metal is down, deficient, okay, if we get time to read all the physiologies, you will understand more. But then now if you see the pulse and you have come out to a conclusion that metal is less and earth element is more. So it is termed as there is some blockage between the flow. Okay. So you can choose a command point, like from here you can choose the metal point, or from here you can choose the earth point. So in each meridian, like you have read Leo connecting point, source points, yes. Likewise in each meridian we have elemental point. So there this elemental point is a, like you can make use of the elemental point with the first step of pulse diagnosis. Okay. So what you can do is, now let us come back to the feeling of pulse. So how to remember, or before I analyze, it's hard for me to remember all the 12 at one stretch, right. So what you can do is, in a notebook or in a paper, first check your, now right now I think we can do that, okay. Check your stomach. So you keep yourself comfortable, take your hand, check your stomach, give some weightage or mark or numbers for what you feel. So you may feel this is 1, you may feel this is 2 or 4 or 5, whatever you feel for your own pulse. Nothing is wrong, nothing is right. Okay. So there is no fixed number like only 3 is right. You can even give 1 or 2 or 3. Just give some weightage for your superficial stomach pulse. You are with me? Can we do this? Can we write down? Yes? You have written? How many of you have written it? Now go for the deep layer. So now you have given a number, certain number, 2, 1, 2, anything. Now go to the deep layer. Do you feel something? Now compare to the stomach, whichever number you have given, right? You must have given 1 or 3 or 2, something. Compare to that, what number or what weightage you are going to give to spleen. Is it more than the stomach? Okay, so give accordingly. So if you have given 1, you feel spleen is 2 or 3, you can give. But you just give some weightage on your own, whatever you feel, because this is totally subjective. What you feel, what you perceive when you touch. Okay. So done. Now let us go for the metal area. Where is the metal area? Right or left? Right, and it is in the distal part near to your wrist crease. So touch, that is superficial, you have your large intestine. Are you able to feel it? Yes? No? If anybody is having difficulty in placing your fingers, you can call me. Or anybody have doubt like whether I am right, whether I am wrong, you can call. Yeah. So give marks accordingly. So now you have given mark for your stomach and then your spleen. So now we are going to give for LI. You are not writing? Not like this, like this. See, this is your middle pulse, this is the proximal and this is the distal. So for you, see here the wrist crease is there. Now this is over the styloid, right? Yeah. So don't, see, take this time to really check your pulse. I will definitely say you can attract your patients with your pulse reading methods or your pulse diagnostic skills. Middle is just over the styloid and one distal, and this is the proximal. Here. Over the styloid, this is proximal and this is distal. Don't place all the three, only one, only your index. Only your index finger. Use your index finger freely. This is distal over the styloid process and this is right. Not like this. Don't go over. Always remember, go from your radial side. And remember the styloid start from center. This is center, the distal, and this is proximal. Yeah. Bit higher, I'll discuss. So I can see somehow everyone are placing your fingers right. Yeah, this, wait, just a second. So this is your center over the styloid, this is your distal, this is the proximal. Yeah. Yes. See, everyone are able to feel the styloid. Yes, just place your index finger over the styloid. And because we have had lunch, most favorable time, you can easily feel the pulse. And just near to it, on your proximal side is your minor fire and the distal one is metal. Right? So only thing is, you should go by this way. See, don't check just for my sake. Because I am walking around, I am noticing, don't check for that. Go like this. See, you should be checking like this. Don't go like this. Check like this. When you are checking it for yourself, it should be like this. One finger. Yeah. So, yeah. This is distal. Yeah, I'd say. That's okay, but you can feel. Yeah. Yes. Only one finger. Center is over the styloid process. Just over. This is your styloid. Over it. That's all. So how many of you have marked really for all the 12? I think we have missed it. See, the basic thing, can I take this? It's okay, I just use for it. I am not sure if everyone can see this. I just scribble here. See, what you can do is, this is, I have just written R, okay, which means right and left, okay. So you can again make two columns, okay. So this is the, just you can write 1, 2, 3. 1 will be your distal, 2 will be your center, and 3 will be the proximal, right. So here, for example, in your right, I start from the stomach. So for example, just an example. So I have written 3, okay. So now you feel stomach, someone of you said it is more than stomach. I can feel more strong pulsations in spleen than stomach. So give 5. When I check for magnifier, I feel nothing. So I feel to give 0. And here in pericardium, I can feel something very mild. So 1. So likewise, I give some or the other marks randomly here and there. So finally, when you see all the 12 together, what is the advantage of writing this? Because we are not 2.0. We are not robots. Definitely we cannot remember all the 12 at one stretch. So we need to remember it, right? So when I write 3 here, I am very conscious what I am writing for 3. And when I go for the deep, I remember when I wrote 3, what was the pulse strength. So compared to that, I can write 5. And now I remember the 5 very much. Now I am going to the large intestine. I remember this 5, strength, intensity, the flow, everything. Compared to this, I am writing 2. So you never forget the sequence. So you remember the pulse strength always, and you come to a conclusion like this. And now when you compare all the 12, so something is going to be high and something is going to be low. Okay. And some normal things which will be common for everyone. It's like now, as I said, after meals, your earth element is going to be bit higher. Okay. So your stomach pulse will be higher immediately after your food, right? And how many of you can feel your minor fire? Where is minor fire? In your right hand, proximal. So just check if you can feel it. Just give a try. So check your stomach and then check your minor fire. Are you able to feel? How many of you cannot feel anything in minor fire? Actually, if you cannot feel anything in minor fire is very less felt normally. Why? Because even in physiology, triple warmer is a controlling factor for your hormonal balance in your body. And pericardium is the energy channel which is protecting your heart. So you can find pericardium excess, which means very dominant, in patients whose mental state is very restless, anxiety patients, anxious patients who are restless, who are tensed, who are stressed, their pericardium levels or pulse will be bit higher. Otherwise, as many of you said, it is not felt. Usually that is not felt. So if you don't feel it, pericardium and triple wormer is the least of all. You might be feeling a pulse, but then it is least of all. When compared to all the other things, that is the least. That should be the least. Right? Okay. And some clues where you can just attract the patient. Right? So for that you need to remember this table. I feel this will be shared with you, so don't try to note it down. Don't write it down. This is available in Google also. See here, the last portion where there is emotion. So try to remember that only. Okay. So your here I would have written only the yin organs. So here there are both. See, these are the yin organs. So when emotions are affected, definitely their yin organ is affected more. Okay. So imagine a situation where you get a patient who is shouting at you, who is not calm, composed. They are ready to give you a lot of scoldings or very harsh words. Definitely we come across such patients. So in that case, for sure the pulse on their liver place will be higher. When the patient is emotionally tend to anger or excess irritability, annoying feel, there the liver pulse will be higher. And when you are relaxed and calm, your heart pulse will be stable. So you see the emotions, right? Anger, joy, worry, sorrow and fear. So try to, this table will be shared with you. Try to remember this. There is a lot of physiology behind it. Okay, but just try to remember these things. Okay. So when you check for a, I'll say some simple clues. Like when you check the pulse and you feel heart pulse is very down. So heart is responsible for the emotion joy. It means when a person is happy, even in modern terms, when you are happy, which hormones are secreted more? Dopamine, serotonin, right? So there is a list of good feel hormones. So that is why joy is related to the heart. Likewise, even now scientifically you can relate all the emotions to the corresponding organs, but now let us not go into that very deep. Okay. So when your heart pulse is very low, when the patient's heart pulse is too low, it means either the patient didn't get proper sleep for last few days, or the patient is depressed, or the patient is a bit sad about something, or just say depressed. We all understand the terms. So when you check and when you feel the heart's energy is low, you can directly ask the patient, did you not sleep well? Or are you depressed out of something? Or are you feeling sad or down? Definitely the answer will be yes. Even if the patient is quite stable, their answer will be, I am not depressed, but yes, because of travel last few days, my sleep cycle has been disturbed. So definitely there is a direct relation between the sleep cycle and your heart's energy. And if the patient is hypertensive and always irritated, they tend to shout more, they tend to show anger more. So you can see that in the liver pounding nature. Okay. So when you place your finger onto the center deep pulse in your left hand, there will be pounding nature and the liver's energy is high. Right. So you can directly ask the patient, are you tensed? So do you tend to shout at your coordinates more, or your relatives or wife or anyone? And how to treat it? Likewise goes all the emotion, but how to treat it? So now come back to the 5 elemental cycle. You have seen liver at the wood part, right? Should I show the cycle again? Yeah. See, you are seeing a pounding, sharp, heavy pulse here, right? So now you need to reduce it. What to do? The cycle goes clockwise, right? So here, when you see the elemental point, liver 2 is a fire point. Okay? You can get the list, or I will share the PDF with you. Okay, there you can have the list of points. So liver 2 is a fire point. When you needle the liver 2, definitely the patient's mental irritation will come down, because that is a fire point where the stagnation is going to be relieved. Someone told me you are going to balance. Through the treatment you are going to attain the balance. So here that is what we are doing. So to counter check the patient's pulse, even like when sometime we are irritated, we feel to shout at someone more. So check your own liver pulse. You feel it is throbbing more, then needle in liver 2. Is there any question at this point? No? No questions? Yes? Yeah. When the patient is, when I said anger, when it is too much of irritation, it is always liver. This I am sharing out of my like experience, or as I have seen many patients, it's always yin, because the general function of yang is to transform, like from here to there. If I am giving a pen here, okay, this is some object, let us consider energy or whatever. If I am giving something here and she is not keeping it for herself, she is just passing it, he is passing. This is a function of yang. Okay, but if I give something, she is preserving it and she is generating more out of it. When I give 1, she is making 2, 3, 4 out of it. That is a function of yin. In very simple one sentence, I can only say this. Okay, so the function of yin is to generate something, produce something, and yang is to transform to other parts what the yin has produced or secreted or made. So all the emotions come out from the yin organs imbalance, right? So that's why we treat the yin, that's why we are seeing the liver, and that will be very obvious in your pulse. So it won't be the gallbladder's area where you see the throbbing nature, it will be the area of liver. So what question I was expecting is, because we are very much attached to the clinical acupuncture books, you might have seen liver 2 or liver 3 should not be needled. Yes? How many of you have seen that? Oh my God, only few. So see, in our textbook it is given liver 2, liver 3 should not be needled. If you are needling, the blood pressure will drastically drop. So this is the indication given in book, but you can, with confidence, you can needle when you find a throbbing pulse in the liver area. Definitely the blood pressure will not drop beyond the normal range. Okay? So that is not a dangerous point. It is a very normal point. You can needle when it is indicated. Okay? So this is how you are going to select the point from that table. So when this is too much, okay, throbbing. So I hope you understand what I mean from throbbing. See, when this is your finger, imagine this is your finger, okay, and this is a pulse. When you give this, I can feel strongly, right? That is the throbbing pulse. I can feel when I touch, I can feel the pulse hitting my finger. Okay, for now we'll remember very basic pulse. There are 28 types of pulse sensations. 28 types actually, but now let us not confuse with all those things. We'll see the superficial, which is termed as floating, and very deep in the sense I touch, I don't feel. Somebody of you, when I was coming, you said, ma'am, I don't feel. Okay. So when you touch, slight touch, you feel hit of pulse like this. You don't hear the sound, but you feel the hit when you touch. That is floating. Okay. So if the feel of the pulse is strong enough, okay, if the feel of the pulse is strong enough, then that is called as throbbing pulse, right? When you touch, you feel, that is the floating pulse here, and when you go down, the pulse is vanished. Do you understand? See, everything is subjective. It is how you feel it. So I touch, I feel the pulse, but when I go down, it is not found. It is disappeared. So that is the superficial pulse or the floating pulse, like the balloon is floating. So imagine when a balloon is on the water, only the top layer of the water can feel the balloon, not the deeper one. Okay. So imagine like that. Try to imagine that feel. If you get that feel, that is the floating one. Deep is something, when you go, you are feeling it, you slightly press, the intensity is increasing. Little bit you are going down, the intensity is more. So we have seen the young stomach. You touch, you feel, but then when you press little bit, you feel it very strong. That is a deep pulse, stronger one. So now only the confusing part for you might be, because you need to check two layers, stomach and spleen. And I said there is a wall in between these two. That's why I asked you to check now only, so that if you are able to feel nothing, still I can help you out where you can feel the difference, right? Only with a consistent practice you will be able to feel, and you can do yoga or you can do palming every day after yoga. And if anybody of you are very much aware with the pranic energization techniques, do that every day so that your fingers start getting sensitized. Even just palming, clapping or practice of mudras will help your tips to get sensitized. Sensitized in the sense, nothing, you touch and you feel it. You get to realize it. Otherwise sometimes we don't feel it. And like even myself, when I am very much stressed out, if I try to check my own pulse, I will not be able to do it. So it is very common for every one of us. So you need to be relaxed and do that. Okay. And what is slow? I said for one breath there should be 4. So if it is only 1 or 2 for one breathing, one inhalation and one exhalation, it's 2, it's only 3, then that is slow pulse. So here it is based on the number. So when I say rapid, it means for one inhalation and exhalation it is 5 or 6 or 7. Okay, so that might be varying for you or for him. One inhalation and exhalation may take 2 seconds, 3 seconds or 4 seconds. For some, one inhalation and exhalation may take only 1 second or 2 seconds. I am not speaking about the breath rate. Regardless of the breath rate, whether it is 12 per minute or 16 per minute, for one breath cycle, it should 4 counts, right? If it is 5 or 6, it is rapid. If it is 3, 2 or 1, then that is slow. Fine? Is there any doubts or clumsy somewhere? No? Are you with me? Really? Then I get no answer. If there is no doubts, no, we feel nothing has gone inside. And there is no student who can understand everything. That is very hard. That is entirely impossible. Okay, I understood everything. So till now you didn't get any doubt. No questions. Sorry? You are asking whether you are going to feel the pulsations of this here. No, you can easily differentiate. You keep the hand and it comes from your hand here. See, when I hold her, I can feel it is coming from this area, not from this. And if you are not calm yourself, then you feel this. That's why I said at the first place, we should be calm and composed, and then the patient should be relaxed. That is the first main criteria to check the pulse. We are only tensed, we are only stressed, we will not be able to read. So you should be calm and relaxed. Even if the patient is going to come and slap at us, we should be calm and composed. Seriously, because definitely we would have come across such patients, right? Yes? And being naturopaths, I feel we come across such patients. You have a lot of role to make them get confidence in your system. So if you are expertised in this, you can easily attract the patients and then you can give the relief. See, if a patient is coming to you with a lot of tension, and within some 20 minutes or 30 minutes, his tension comes down by doing nothing. You are only giving pressure or you are putting a needle. Definitely the next visit will be very easy for him. You need not sit and convince him for the second visit. See, that is what happened with me at many times. Otherwise, you need to convince a patient and bring him for the second visit, because we need consistent time for treatments. Not in one sitting like paracetamol you heal everything, right? Or am I wrong? I think I am right, because one day is not sufficient for naturopathy always. You need some time, okay? So for that, these things, your IRE diagnosis, the whole session of this 2 days will help you, okay? So I will share this points, but you can get online also. So that is going to help you. And this, so this part, did you understand? Yes? What is floating? So can any one of you come and say whether my pulse is superficial or deep? Anyone can come. See, this is a chance for you to learn. Nobody want to come? Who are all students here? She have already come. So I think students can come. You must be more interested. No? Why are you thinking so much? Come. Come, come, come. See, sir wants to give her a big round of applause. So now I have a doubt. Are you really trusting your method of diagnosis? I don't think. Now I have a doubt. I feel no. Are you really trusting? Or you feel these are all vague? What is facial diagnosis? No scientific thing behind it. Nothing science behind pulse. Do you feel like that? Then I don't find any volunteer coming up. If you really feel this is the science, then you will be coming friend, right? Check. One finger. So you can hold this. Even forcefully I have made her to come on stage. She will be seeing a better, she will be able to read pulse better than any one of you in future. Because now her fear will go away. She will be more tensed. She is more palpitating now. Deep. Check again. Wait, relax. Can you feel? Just touch. Can you feel? So this is superficial. That is the second layer. That is for the second layer. So it is deep. This is superficial because you touch, you feel.
So floating is something which
You touch and feel.
But when you go deep, you won't.
See, now she will be more clear than any one of you, because this happened with ourselves also. So, did you understand? What did you understand? Can you say?
Okay, so whenever you palpate on the superficial, you feel the pulse.
You can speak.
Okay.
You can speak, don't forget, they are all your students now.
So whenever you palpate on the superficial, so you feel the pulse, but when you go deep or like you press the, you won't feel. That is known as floating. And when you feel the pulse of the superficial and also when you press it deep, that is known as a deep pulse.
I think she understood better. She might not be clear to yourself, but then she would have understood that. So what she felt, see, when she touched, when she was feeling my superficial, she was touching my skin, she felt a pulsation. Okay, so you touch the skin, you feel it, that is superficial. And when you go down, see, this is the first layer. You touch, you feel. You touch here, you feel. When you go down, you don't feel. Now you are going to the second, that is the in organ. Now you feel here. Again you go, you press more, that vanish. So that is a superficial pulse. So when you touch, you feel it. When you go down, you don't feel it. That is a superficial one. So what is the meaning when something is superficial? So 5 minutes can I take? See, when pulse is very superficial, it means a person's yang is more. Okay? So you need your yin and yang to be balanced. So here I just inserted one slide for you to understand. Yeah. See, here you can see the red color is a yang part. So red means your blood circulation is more, your body heat is more, you are active, you are enthusiastic, you are excited. And here it means blue means you give for someone to make them sleep. Right? So that is to calm down someone. There something is slow, something is less, something is chill, cold. So where the movement is very less. So when the pulse is slow, not rapid, When the pulse is deep, it means it is coming into this category. And when it is active, rapid, superficial, it goes to the young. Okay? Why I am saying it here? Because even this plays a major role in pulse diagnosis, but here, at least from today's class, what you can take is, if you feel this superficial pulse, heat, it means their body is already under the yang is more. So you need to give them all cold treatments or all neutral therapies, neutral water treatments, not hot. So giving them, like even when it is coming to food, giving them hot soups will not solve their problem. When you give hydrotherapies, give cold water therapies, give neutral water therapies, that is going to help them. And when you feel this already cold or yin is activated in the person's body, right? So it is deep, it is very slow. So cold water therapies is going to make them still more slow. Or if you are very expert, you can play with the duration, very short cold. Like that you can design the treatments if you are able to differentiate the pulse. But only based on acupuncture, you can make use of the 5 elemental cycle. Okay? As I said, if liver is more in your chart and you need to sedate the liver, sedate in the sense remove excess energy from it, give the child point or sun point or the element next to it, fire point. Okay? So in that cycle, the next element, if it is excess, if this is excess, so if I would have given number 5 here, okay, so you have to, and metal is maybe 1, 2 or somewhere below 5, okay, you need to give metal point in your earth, where the energy is going to go down, right? Yes, here it is down, but in our body it is a cycle. So like this you will have to give. But if it is deficient, what if spleen is 0, you didn't feel anything, or stomach is 0, you need to get from here. So fire and earth will be related. When here it is more, earth and metal will be related. Did you understand this? Yes? Make it very clear, energy is not going to flow in the opposite direction. Right? Energy always flows in the clockwise direction here in this chart. In our body it is everywhere, organs are everywhere, but from heart it goes to spleen, from spleen it goes to lungs, from lungs it goes to kidney, right? So why I am insisting on this, because when you select the point, you need to select in that fashion, not randomly. The earth point to the metal, it means you are sedating the earth, you are giving energy from earth to the metal to reduce the energy in this. That's why I told you to put numbers, so that wherever you see the highest number, select that, select which is the child or which is the element next to it, and select the elemental point and prick the needle. For sure 100% you will see a change in patient's symptoms. Let it be pain, let it be any sort of abdominal pain or any pain or some mental depression or irritability or any burning sensation, anything. So this is going to help you a lot. After this, there is a lot of stages where you will have to change the points and give. But then today I feel at least if you are taking home this message, that is like so much for us. Okay. So, and as a last point, factors to consider, it's nothing new. So last what I would want to say is, so we have discussed all these points. Consistency is a key. keep checking your pulse as soon as you wake up in the morning. Check your pulse. Write it down. Write the time, write it down how you feel. First day you may not feel something, it's okay. After your breakfast, before your breakfast, after your breakfast, when you feel thirst, check your pulse, note it down, have water and then check your pulse. Have your lunch, check it. If you are doing yoga, Surya Namaskar, check your pulse before and after. And try to catch anyone's hand, not on the roads. I didn't mean in that way. In your home, in your family, or if you are students in your hostel, in your rooms, catch all your friends' hands and check the pulse. If someone is angry, your friends, check their pulse. See if their liver is more. Okay? So it means what I want to say is take every opportunity to check the pulse at different stages and try to understand and experience. Who knows, you may become expert than me, because I am still learning. I am not able to become an expert. So if you are doing it consistently, you might come to take acupuncture pulse diagnosis class for me and I may be sitting there. Right? So will you practice? I cannot hear. Yes, still I can see some heads down. You can see your mobile anytime and you can see me only today. So, any doubts, any questions? No, this makes me feel you didn't understand anything. So, if you have any questions, you can ask. Or else I have taken more time. I want to thank Sir and the college for giving me this opportunity for meeting you all at this place. Did you find it useful? Sleepy? Who knows? God knows. Nobody came in between. There was no doubts, no questions. I was worried how to answer your questions. No, it's okay. I am very much happy to be under trouble. And you should not say that. You are already practicing it. So, actually this is, if any one of you want to explore TCM more or learn this in depth, okay, for the doctors, not for the students. So, there is a fellowship course in NIN in the basic and advanced acupuncture where whatever I said in TCM is taught in whole. Because this is very much interesting and I was able to touch only 1% of that. Because today I have to give you something, so I don't know how much I gave or how much I shared, but there is a lot of ocean. Today is only one drop. So if you are interested, you can do that, not because that certificate is going to give you some jobs, but then you will be able to learn something new. You can put your mind, as he said, he is exploring. You can explore many things into the patient and give wonderful therapies. Because I now seriously believe and I know that with naturopathy you can treat any patient. Even it is only the final stage, if the patient is coming you at the last stage of cancer now, still you can relieve their pain or suffering. Okay, you cannot reverse from the final stage. But yes, you can relieve their pain, you can relieve their suffering at that point. But then you can do wonders. So keep learning, try to ask more doubts. At least we will learn something new. Thank you all.
Thank you for the wonderful session, ma'am. Now I request Dr. Padma Shri ma'am to hand over the token of gratitude.
Thank you, ma'am.
So next we are going to for the next sessions of the Chromo diagnosis. Before we are extending, anybody want to have the small break for 5 minutes? Those who want to go out and come back? Okay, your time starts now.
Exact 5 minutes.
Yeah, that's what, 5 minutes. ಅವ ಎಂತ ಇದಕ್ಕೆ ಹೋದ ಪಿಯರ್
ಅದಿನ್ನೂ ಅವರಿಗೆ ಬೇಕಿತ್ತು ಪಾಯಿಂಟ್ಸ್ ಎಲ್ಲ ಏನಿಲ್ಲ ಆಲ್ರೆಡಿ ಪಾಯಿಂಟ್ಸ್ ಆ್ಯಕ್ಚುಲಿ ಅದು ಒಂದೇ ತೊಗೊಂಡು ನಮಗೆ 2 days
ನಾಳೆ 9:30ಗೆ ವಿ ಸಿ ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ಆಗಿದೆ. ಸೊ ಡೈರೆಕ್ಟ್ರನ್ನ ವಿ ಸಿ ಕರ್ಕೊಂಡು ಹೋಗಿ ಸೊ ದೆನ್ ಐ ವಿಲ್ ಗೋ ಡೈರೆಕ್ಟ್ಲಿ ಟು ದಿ ಇದು ಇನ್ನೇಕ್ಕೆ ಹೋಗಿ ಬರ್ತಾರೆ ಸಿಗ್ಲಿಕ್ಕಿಲ್ಲ ನನ್ನ ಬೆಳಿಗ್ಗೆ ಅವರನ್ನು ರಿಟರ್ನ್ ನಾನೇನು ಮಾಡ್ತೀನಿ ರೂಮಿಗೆ ಡ್ರಾಪ್ ಹಾಕಿ ಏರ್ಪೋರ್ಟಿಗೆ ಬೇಡುವ ಅಂತ ಅದು ಏರ್ಪೋರ್ಟಿಗೆ ಹೋಗ್ಬೋದು ನಾವು ನನಗೆ ಕ್ಲಾಸ್ ಸೆಷನ್ಸ್ ಇಲ್ಲ ಬಟ್ 11ಗೆ ಹೋದರೆ ರಿಟರ್ನ್ ಬಂದು 1 ಗಂಟೆಗೆ ಅಲ್ಲ ವೀಳ್ದಿಕ್ಕೆ ನನಗೆ ಇದು 2 ಗಂಟೆಗೆ ಇದು ಇಂಟರ್ವ್ಯೂ ಸ್ಟಾರ್ಟ್ ಆನ್ಲೈನ್ ಐ ಹ್ಯಾವ್ ಟು ಬಿ ದೇರ್ ನಾನೇನು ಮಾಡ್ತೇನೆ 2 ಗಂಟೆಗೆ ಇಂಟರ್ವ್ಯೂ ಸ್ಟಾರ್ಟ್ ನಮ್ಮ ಫಸ್ಟ್ ನಾನು ರಿಕ್ವೆಸ್ಟ್ ಮಾಡ್ತೇನೆ ಸೊ ದಟ್ ಅಟ್ ಲೀಸ್ಟ್ ಬೈ 2:45 ಬಿಫೋರ್ ಐ ವಿಲ್ ಕಂಪ್ಲೀಟ್ ಹಾಗೆ
ನಿಮ್ಮದು ಇದನ್ನು ತಗೊಳ್ಳಿ ಸ್ಲೈಡ್ ಉಂಟಾ ಕೊಟ್ಟಿದ್ದೀರಾ ಅದೇ ಅವರಿಗೆ ಕೊಡಿ ಆಮೇಲೆ ಅವರದ್ದು ಗೌರವ ಅತಿಥಿಯಾಗಿ ಶಾಂಭಟ್ ಅಲ್ಲ ಗೌರವ ಅತಿಥಿಯಾಗಿ ಇವರು ನಮ್ಮದು ಪ್ರೊವಿಸಿ ಗೌರವ
ಅಧ್ಯಕ್ಷರಾಗಿ
ಅಧ್ಯಕ್ಷ ಶ್ರೀಪತಿ ಗೌರವ ಅತಿಥಿಯಾಗಿ ಇವರು ಸತ್ಯಲಕ್ಷ್ಮಿ ಗೌರವ ಅತಿಥಿ ಸತ್ಯಲಕ್ಷ್ಮಿ ಅತಿಥಿ ಇವರು ಅತಿಥಿ ಶಾಂಭಟ್ ಗೌರವಾನ್ವಿತ ಅತಿಥಿಯಾಗಿ
ಅಲ್ಲಿ ಅವರು ಉದ್ಘಾಟನೆ ಮಾಡಿದವರಲ್ಲ ಶ್ರೀ ಸತ್ಯಲಕ್ಷ್ಮಿ
ರಾಷ್ಟ್ರೀಯ ಅತಿಥಿಯಾಗಿ ಆಗಮಿಸಿದ್ದರು. ಗೌರವ ಅತಿಥಿಯಾಗಿ ಡಾಕ್ಟರ್ ಶಾಂಭಟ್, ಅಧ್ಯಾಪಕ ಡೀನ್ ಯೆನೆಪೊಯ ಅಧ್ಯಾಪಕ ಅಲ್ಲ ಅವರು, ಅಧ್ಯಾಪಕ ಬೇಡ, ಡೀನ್ ಯೆನೆಪೊಯ ದಂತ ಮಹಾವಿದ್ಯಾಲಯ. ಇದು ನೀವು ನಿಮ್ಮ ಹತ್ರ ನಿಮಗೆ ಇದು ಬರಲಿಕ್ಕಾಗುತ್ತಾ? ಕನ್ನಡ ಇರಬೇಕಲ್ಲಿ, ಆದರೆ ಚೇಂಜ್ ಮಾಡಿ, ಎಡಿಟ್ ಮಾಡಲಿಕ್ಕಾಗ್ತದಾ? ಇದನ್ನು ಪುಣೆಯ ರಾಷ್ಟ್ರಪತಿ ದೇಶಕ್ಕೆ ಸತ್ಯಲಕ್ಷ್ಮಿ ಗೌರವ ಅತಿಥಿಯಾಗಿ ಆಗಮಿಸಿದ್ದಾರೆ. ಗೌರವ ಅತಿಥಿಯಾಗಿ ಆಗಮಿಸಿದ್ದಾರೆ. ಬೇಡ, ಉದ್ಘಾಟನೆ ನಡೆಯಿತು ಸಾಕು, ಅದೆಲ್ಲರೊಟ್ಟಿಗೆ ಮಾಡಿ ಉದ್ಘಾಟನೆ ಮಾಡಿದೆ ಅಂತ. ಅತಿಥಿಯಾಗಿ ಆಗಮಿಸಿದರು. ಇಲ್ಲಿ ಉಂಟಲ್ಲ, ಅತಿಥಿಯಾಗಿ ಉಂಟಲ್ಲ, ಆಗಮಿಸಿದ್ದರು. ಡಾಕ್ಟರ್ ಶ್ಯಾಮ್ ಎಸ್ ಭಟ್, ಅಧ್ಯಾಪಕ ಬೇಡ, ಡೀನ್ ಯೆನೆಪೊಯ ಮಹಾವಿದ್ಯಾಲಯ. ಇವರು ಅತಿಥಿಯಾಗಿ ಹಾಗೂ ಪ್ರೊಫೆಸರ್ ಯೋಗಿ ಡಾಕ್ಟರ್ BS ತ್ಯಾಗಿ ಹಾಗೂ ಪ್ರೊಫೆಸರ್ ಡಾಕ್ಟರ್ ಶ್ರೀಪತಿರಾವ್
ಸ್ವಾಗತಿಸಿ ನೀವು ಧನ್ಯವಾದ ಸಮರ್ಪಿಸಿದೆ.
ಇಲ್ಲದಿದ್ದರೆ ಶ್ರೀಪತಿರಾವ್ ಅವರದ್ದು ಫಸ್ಟಿಗೆ ಬರೀಬೇಕು, ಅವರು ವಿವರ ಅಲ್ಲ.
ಅತಿಥಿ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ಮೊದಲಾಗ್ತದೆ, ಅತಿಥಿ
ಅಧ್ಯಕ್ಷತೆ ಫಸ್ಟಿಗೆ ಆಗ್ಬೇಕಿದ್ದಾರೆ. ಉದ್ಘಾಟನೆ ನಡೆಯಿತು. ಮತ್ತು ಡಾಕ್ಟರ್ BS ಶ್ರೀಪತಿರಾವ್ ಚಾನ್ಸಲರ್ಗೆ ಅಂತ ವೈಸ್ ಚಾನ್ಸಲರ್.
ಕನ್ನಡದಲ್ಲಿ ಸಿಕ್ಕಿದೆ.
ಉಪಕುಲಪತಿ ವೈಸ್ ಚಾನ್ಸಲರ್, ಉಪಕುಲಪತಿ ಅಂತ ಹೇಳಿ.
I request all the participants to come and assemble for the next session.
ವೈಸ್ ಚಾನ್ಸಲರ್, ಉಪಕುಲಪತಿ, ವೈಸ್ ಚಾನ್ಸಲರ್, ಸಹ ಉಪಕುಲಪತಿ. ಕೇಳಿ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ. ನಾನು ಹೊರಗೆ ಹೋಗಿ ಬರ್ತೇನೆ, ತಲೆನೋವು ಹೋಗ್ತದೆ ಮಾತ್ರ. ಈಗ ಬರ್ತೇನೆ, ಈಗ ಬರ್ತೇನೆ.
Good afternoon, everyone. We will start with today's third session on Chromo diagnosis. I request everyone to assemble as soon as possible. Good afternoon, everyone. We'll start with today's session, third session on Chromo diagnosis. We have an outstanding speaker, Dr. Punit Raghavendra, BNYS MD, PhD, Principal in charge, YENEPOYA Naturopathy and Yogic Science College and Hospital, YENEPOYA deemed to be University, Deralakatte, Mangalore. Dr. Punit Raghavendra, consultant yoga, is an eminent academician and a researcher in the field of yogic sciences. He was born on 4th of August 1986 in Kuntukadu family of Sulya. He has completed his BNYS at SDM College of Naturopathy and Yogic Sciences under Rajiv Gandhi University of Health Sciences, Bangalore in the year 2009. And then he had completed MD in Clinical Yoga at the same institution in the year 2015. He was a medical officer in the Government Nature Cure and Yoga Center, Puttur, before becoming the Deputy Director for Naturopathy College at World's renowned Yoga Institute, S. Vyasa, deemed to be University in Bangalore. He has conducted several kinds of research in yoga in India as well as in Germany about cerebrovascular changes following yogic practices. He has published several research papers in international journals and has got 8 years of academic experience. Academically, he is recognized as a member of the Board of Studies and External Examiner at Alagappan University, Central University of Kerala, Madhya Pradesh Medical University and Rajiv Gandhi University of Health Sciences. He was invited to speak at several international and national conferences and workshops at yoga and about yoga studies. Currently, he is working as an associate professor and in-charge principal for YENEPOYA Naturopathy and Yogic Science College and Hospital, YENEPOYA deemed to be University, Deralakatte, Mangalore since 2022. We are eager to hear from you, sir. Over to you.
And now, fine. Very good afternoon to all. So we have reached to the last sessions of the day. And I know that it is very difficult to attend the afternoon classes, right? Purva janma kritam papam vyadi rupena badhyate, we say that. Whatever the past life sins, they will come in the kind of the diseases. Among that, one of the disease or the suffering is the taking class in the afternoons. And those who have the maximum sin, maximum papa, they will listen in the class. Because at least I have the provisions to walk around and you can have the only one positions to just scratch there, that's all, nothing else. Right? Fine. I know what are the difficulty for the sitting like this way. Because after the time span of my 8 years in the academics, last day I was attending one more PG diploma classes here in our YENEPOYA itself, PG diploma in bioethics and the medical ethics. That was throughout the class. Usually what happens, we are being in the administrative as well academicians, we will never sit in one place. And on that day I felt the real, again back the pain, what was the sitting for the longer durations. So it's not so easy to sit like that way. So that is the reason I'll give one very good news for you. We'll say finish the session by 4 o'clock. Fine? Sure. Fine. So the today's topic for the discussion is the Chromo diagnosis. As well, what are the importance of the color in the life? So just imagine if the whole world would have been in the single color. At least in black and white you have the two options of the color. If it is only the white, right? This is how a zebra has got confused. Whether it is the black strips on the white or the white strips on the black. Anybody have the answers for this? Whether zebra has got the black strips on the white or the white strips on the black. It's actually a white, okay? It's actually a white, so the black strips on the have this on the white, okay? That's for the zebra. Fine. So color has the power to place the stresses and the strains or peace and the tranquility. See, most of the time, we will be more happy when we see different kinds of the colors than a single color. That's how we can see right now. We have with the various colors here, with the dress material, with the physical also by face, and our study materials, especially the pen, have the different colors, right? So we all expect these kind of the color. It's for the stress and the strain to overcome as well. It gives us happiness, calms our mind, and gives us a positive thinking. So thinking is also very important. The positive thinking is a very must. It brings us a very calm. You know that when you see a red color, that's a red alert. When there is a white color, we always see like, oh, okay, that's a very calm and cooling. So that's the reason all the doctors will wear the white aprons. Fine. But don't expect during the internships and all that color will be converted into the brown also. Most of the time. Even during the college periods also. I don't know why the people they have brought the scrubs with the different colors. We can see the scrubs here. If you will have the white in color, if you will the green in color, black in color, even I have seen black in color. So when you go in the white coat, very common is the patient look as to, he'll become the calm and cool. They will not start the shouting at last. Always. I think that is one of the reasons. As well, you know that white is a symbol of the purity. So that's the reason white has been brought. Okay. So just look at here. How is it? Are you feeling happy? Interesting? Just imagine it was a single color. Only the single color. Okay, like our college uniforms. Even though you don't want to wear, you should wear the same color itself. I think that is the only one way. The scrubs color has been changed, but no one doctor is asking, I want the green apron or the brown aprons. They want only the single aprons because they have been habituated, because they have made them to be peaceful in that. The same way here, we look into the various kinds of the different colors. Fine. So, from where these colors from? Because sun rays will not give the multiple color. There is a single rays. So there is generally the white in color. So these colors have been scattered into the different forms. It has been found in the 1666 by Isaac Newton. He was the first to use the term spectrum for the range of the colors that white light could be split into with a prism, what we can see in the form of the rainbow. That's how. As well, Newton showed that these colors will be the intrinsics to light and could be recombined to form a white light. When a single rays of the light is passed to a spectrum, so there will be a prism, it will be the separate, and when you combine that, they will frame into the single. So does it mean before that light was unaware, color was unaware, people were unaware about the colors, or it has been invented by the Newton itself? Any idea? This is what the unaware or the ignorance what we have, because we accept whatever have been come from the Western science, it's only the fulfilled. Isaac Newton said the color has the 7 rays, 7 different rays in the white color. That's what we are accepting. but there is an Indian origin behind that. So I want to share it with you. Aruna Prashna, one of the beautiful texts which has the first chapter of the Taittiriya Aranyaka, part of the Taittiriya Krishna Yajurveda. They say that Sakam Jananai Saptata Saptatam Ahur Ekajam. Saptatam Ahur. Though there are the 7 rays, they will be the scattered. As well, Shadudhyama Rishayo Devajaiti. So there is a Rishi states that the 7 rays, the Vibjo, they are arising from the 1 ray. So it's nothing but the Surya. And they will form into the different, and then they will combine to cause the 6 seasons. But you have the 6 Rutus. 6 Rutus, they will be framing that. Our Hemanta, Grishma, Vasanta, Sharad, Varsha, Shishira. So these are the 6 Rutus will be framed by because of these rays. That's what we are unaware. So what we call, okay, chromotherapy, it has came from the Western origin. No, it's not. It has been originated from our own ways. Okay. Let us continue. You would have been seen here. Emojis. Correct? I have one question. Why there is a red emoji here? Why it should be represented in red only? Similar, no? What you can see at the bottom. Both are the same, but still you want to look into the red. Why you want to look into the red? See, that also anger only. Those are in the one more in the new at the bottom. That's also kind of anger. But what is the changes when you look into the red with the anger? Very, very angry. Good. Very, very angry. So that shows you the intense, our personality also depends on our color. Fine. So you can see the whole emojis they have with the single color. It may be yellow in color, not everyone will not be yellowish like that, but still they will be the representing similar to the yellow. But you can just look into the anger. Anger they have been easily showed. When you show that the red in, that's very clear. That person is danger. Not person is in danger, person is danger. Correct. So then how we can say that differentiated between. So these personalities, what are the, one of the published paper, what I can give it with the PubMed ID. So they were the survey has been conducted around 150 subjects. They found that those who like the green, they are usually with the extroversion, yellow, agreeableness, light blue and the dark blue, they are the conscientiousness, red and the light blue, they are the emotionally stable, as well the green, they will be open for all new opportunities. So just you call, expect yourself, you can think yourself, which color you like. Out of all these 5. Right? So that plays your personalities. That plays your personality depends on the various colors. So these color can be used in the diagnosis of the various diseases because that's also roots with the Indian roots. You can get it from the online also. I have just placed it. I guess you would have been come across this, right? Various colors of the Vijnana from to the various kinds of the chakras. This everything we have been come across with their nature and connected to the various glands. So I no need to repeat again. These are continuations, fine. So ultimately we are reaching into the one concept of what I mean by chromodiagnosis. So chromodiagnosis is a method to assess the internal conditions of the different organs by observing the color changes in the body or any kinds of the excretions from the bodies. So human body is composed of the all 7 colors. Do you agree? Fine. Our internal organs from inside also will have all these 7 colors. Now we cannot ask there are the 8 colors. No, it cannot be the 8 colors, because any white rays will be spectrum into the 7 rays only. All these 7 rays will be there in our physical bodies. We have the red, you know that, correct? Yellow you can see in our body. White you can see in our body. As well the oranges you can see in body. Violets you can see in our body. Most of the glands, which is generally even liver, which is a violet in color, even spleen violet in color, that's what you can see. So all these colors will be represented in the physical body itself. So all these 7 colors, we also use it for the diagnosis of the various diseases. First, let us go for a simple diagnosis of an eye. Generally the sclera, what you observe, sclera which is the whitish in color, they will be reddish when they are the fever, and also they will be yellowish in color, the significance of the liver and any kind of the kidney disorders. You may call it as a chromo diagnosis, a kind of general physical examinations also, but we mainly focus on the color changes in our physical bodies. So all the red will not be the fever. It might have been over usage of the mobile also, correct? Late night watching the movies even till midnight, 11, 12, 1 or beyond that on Saturday nights. Huh? PUBGs they have banned very good then. Or it would have been furthermore continued. Right? So exposures to the over technique, so that's also one of the reason as well. Anemia. The pale eyes, the commonest you can see that, anemia. Most of the people, they want to look the very fair, but they don't want to look like a pale, correct? So there is anemia, one thing. Blue, you can see the sclera blue, commonest in the cyanosis. The centralized cyanosis, what you can call, not in the peripheral, centralized cyanosis. Causes of the cardiac as well, the respiratory causes, common. As well, severe iron deficiency anemia, where you can see the blue kind of the scleras. Okay. Next is the tongue. So tongue is the mirror of the physical body. Do you agree? I think tomorrow we'll have furthermore discuss on the tongue. Sami will take it on the tongue diagnosis. That will give you the much more idea. However, tongue is one more reflections of the physical body. So they usually constipated. That is in the white coated. That's the reason in the fasting we say that when we have to stop the fasting, when the tongue is clear and the coat is removed. Okay, so that's one. Fever, indigestion. You can see the whitish coat is on the tongue. When there's a dehydration, you'll see the dry tongue as well. White coating with the red spots. Hardly you can see with the scarlet fever. Yellow, you know that it's due to the jaundice conditions. As well, pale in anemia. As well, dyspepsia. Anemia may be due to of any cause. Okay. In Indian cause of any kind of the worm infestations also, you can check out with that of anemia. You have to rule out then. As well, the shiny tongue because of the dysentery. Blue in the cyanosis. As well, cardiac complaints and in case of the poisons. So this is the white tongue, what you can see with the constipated, fever and the indigested. Okay, what you can observe clearly. As well, clear tongue in case of the acidity. You can also in the acidities, you can observe with the sides with the some splits kinds of the changes, what you can observe in the acidic conditions. Next is the urine. So normal urine color is a straw yellow with that of the dark yellow will be jaundice and the diphtheria, where the light will be diabetes. In rheumatism and malaria, it will be the more dark red with the hemorrhages, the foggy in the albuminuria, and generally orange color changes in the body during that of the fever. This is a foggy urine, you can observe. Foggy urine, or I also call it as a smoky urine. Foggy or the smoky urine, both are the same, seen in the albuminuria. The stool, the black in the hemorrhages, and you know that if the stool with the flesh blood, that is a reddish blood, you can say that the origin from any of the rectum, and if it is the darkish, means it is from the any lower intestines. Clay as well, the muddy in the jaundice, watery in the diarrhea, and the white troubles in the liver as well the stomach and that of the kidney, as well dark brown, the poisonous conditions, right? As well the constipated also will have the quite darkish and the dark brownish, not the blackish. Skin, you have come across with these kind of the color changes, right? That is the blue in the cyanosis, as well the polycythemia vera. Rheumatism and the menstrual problems, you will have the dark reddish, as well the anemia, you know that it's a very pale. Purple in the heart and respiratory ailments, and well pigmentations with the diabetes mellitus. So the prolonged exposures to the arsenic treatments also, they will leading into the pigmentations. Okay, well, let us show the few photos here. Before that, we'll have the nails, the blue nails. Okay, the blue nails, there's respiratory disorders like the pulmonary obstructions and emphysema due to hypoxia induced, they'll be leading into the blue nails. Blackish in the vitamin B12 deficiency, as well some of the bacterial infections, mainly into the white kidney and the white in the kidney and the liver disorders. You can see the white lines there. White line blands with the proteins or the calcium deficiency, with that of the brittle nail, right? As well the green nail we can see in the arthritic and the edema. The yellow nail and the lymphatic with that of the liver problems. I have not brought the pictures here, I think we have been come across. Then last in the lips, one more. So the healthy people will have the reddish, average, moist and shiny lips. But this is one more challenge for all the physicians now to find out the lips. Correct. You cannot do anything here. You have to accept if it whichever the color, oh, it is a very bright color. Which is a dark red, oh, it's a scarlet red. Fine, you have to accept it. Nothing can stand. Pale, you can see in anemia. Gastritis will have the very red. Excess heat of the body, they'll have the bright red. The excess heat, the cause may be the lower intake of the water. Right? Sleep disturbed. As well, blue and the purplish in the respiratory or the circulatory disorders. You would have been come across these. Smoker slip, the dark brownish, the blackish. Not the upper only, you can observe clear also the lower picture. That gives you the clear instructions about that. Okay, that is a smoker slip. Observing the extremities, physical bodies. So they are the hands and the legs. Usually you can see the red in the cold conditions. Purple body changes in the fever and the inflammations. Blue kinds of in the fear or the excitements. Then the pale in the anemia and hyperpigmentation in the diabetes. You would have been come across regular with the hyperpigmentation of the diabetic foot, right? Seen this kind of the food? Okay, that is due to the increase of the peripheral resistance. Increased peripheral resistance always leading into the hyperpigmentation of the lower extremities of the bodies. Okay, so with this, the recent advances, they are like the same color can be used in the diagnosis as well management of the various diseases that has been explained in the Kirlian photographies. What they do, have come across these words, Kirlian photographies? What they do generally in the Kirlian photography? Aura, obviously. Fine. So what happens when the body also, what do you mean by aura actually? Before I continue. Whether it's the vibes, or the energy, or the heat, energy. So whether energy can be changed from different place or the times. Fine, right? So these are nothing but the working on the electromagnetic changes itself. What happens? Most of the time you would have been experienced when you have not found a very good sleep at night, the next day the energy will be the down. Fine? As well, the result of the examinations. Correct? The next day it will be the energy will be the down or the overtrained. Or always I will say that the energy of a student when he approaches a leave, it will be always higher. Correct? When he want to take the leaves, he will come by running to the colleges. And if I call for any assignment, that will be delayed. That's what it called as energy. Energy will be always changing. That's why it is called as it's a kind of the stress. What do you mean by stress? Physiological disturbance, responses. So there is no any pathological responses behind that. Disturbed mind, distress, speed of mind. Fine then. See, generally we say that stress cannot be a stressor until unless you stress it. Correct? Stress cannot be a stress until unless you stress it. That's the reason always I say stress is a kind of the person who prepares, or woman prepares a biryani at the home. Correct? When you prepare the biryani at the home, for your own home people, that will be the very beautiful on that day. Suppose if the other relatives are coming on that day biryani will be the worst itself. Then the commonest dialogue, har din jaisa aaj nahi aaya hai. So that is a kind of distress. Fine. If I say you, all the students, you have to report to the college morning 4 o'clock for a week period, for the 108 rounds of the Surya Namaskara practice, then it will be very stressful. Correct? If I say you have to report to the college at morning 4 o'clock, and by 5 o'clock we have our trip to somewhere other places, then it will be ready by 3 o'clock only. I don't need to wait for 4 o'clock. Correct? So that's a kind of the stress. These stress also, that's a different persons to person. Everyone cannot have the same level of the stress. It's like one girl will be crying if she has got the 99 out of 100, and the 3 boys will be happy out of these marks. Correct? Because 33 average is sufficient for the passing. So that depends on the perceptions. Everyone will not have the same kinds. But whatever, the energy drained from out of that, or the energy what comes out of from that will be the changes from persons to persons. So what the Kirlian photography does here, these energy levels, they are captured. These captured energy level, they are converted into the different kinds of the color forms, and that color forms are utilized for the diagnosis of the diseases. As well, the specific colors, they are the lesser or exaggerated, they will be considered as, okay, this person has some kind of it may be the mental disturbances, right? And you know that any kind of the physical disturbances, the cause is a mental disturbances only. As we know, Anandamaya Kosha is one of the most. Correct? Anandamaya Kosha is one of the most for any kind of the diseases. Most of you students, you have been converted into the, you have become into the faculties now. You would have been asked yourself, when you are in the college period, morning you had a sneeze, so you did not come to the college. After joining the job, you are having the fever since 3 days also, you are coming to the job now. Yes, no? So that's what. So the energy level did not alter. Even though it is altered, it is maintained. So that's what we do in the Kirlian's photographies. Using the Kirlian photographies, we assess our aura as well to the energy. The changes in this aura or the energy level, they will be representing the what is the cause for the diseases. Okay, what is the energy level? You call the next level. You can call it as an vitality also. In yoga, you can call it as an prana. Acupuncture side, you can TCM side, you can call it as an chin. Right? So these all are the same. Okay, in the modern science you can call it as an immunity. Fine. Right. So this is what. So that's what the Kirlian photography does on the color changes, the recent advances, what you can see, how the color is also used for the diagnosis, changes of these auras represented in the kinds of the colors, and later they will be converted into the management of the diseases. So they will take the pre-post assessment, mostly in Kirlian photography in SVS it is still there, right? Fine. So when you have the next visits to there, you can check it within SVS for the Kirlian photography of your zone. Okay. So with this, we'll come into the small exercise. Fine. Small exercise. So you have the writing pad, and you will have one subject who is next to you. Okay, who will next to you. We'll have a small workout for the 5 to 7 minutes at last. The first level there will be the questions. Okay, write down that questions and answers for that. The same way, opposite side, you have to observe the eyes, observe the tongue, the lips, hair, skin, palm and the foot. Whatever you are finding, just write it there. So at last what we will do, we will randomly select one person, and he will be not called here. From there only he can explain what and all he has been finding. And if you have any doubts when you are finding this maybe, you can just let me know, we will do that. Okay? Fine, let's start. Take a person next to you, sufficient. The very important question, the first line, the last question. Fine? So kindly look into the eyes of your friend, those are next to you. Okay? As well ask him to open the tongue. mainly focus on the tongue, eyes, lips and the skin along with the hair. No need to consider about the palm and the foot, but these are the major because they are directly related to the previous questions. Fine. So, fine. So, we'll ask any one person. Hope everyone knows your registration number. Fine. Shakti, say one number. Today's data? Illa. Okay, today's whole date you add it. We'll take that number. +22 + 2. Alana, 11 0 2 4. Yeah. Okay. Okay. So we got one randomized number. Today's date is 11/3/2024. When we added it, we got the number 22. Please raise your hands. Those who have got the 22. 22. Yeah. Excellent. So this is how we do the randomization. Correct? Fine. Please, what and all, any findings you have been brought there? Okay, let us continue in this way. You can come, please. What was the water intake?
Water intake was 1 to 2 liter.
Fine. Food intake per day?
3 to 4 times.
Huh?
3 to 4 times.
3 to 4 times. Fine. And what about the food timings?
Food timings.
Whether they will have breakfast in the lunch in the evenings, is it so?
Breakfast, most of the time skipping the breakfast.
Okay.
Lunch around 1 to 2. Dinner 7:30 to between 8:30.
Fine. Sleeping duration?
8 to 9 hours.
Fine. Sleep pattern?
Sound.
Sometime. Bedtime?
11 to 11.
11 to 12. Okay. Waking time?
8:30 to 9.
8:30. Huh?
8 between.
Fine. So the bowel pattern is regular?
No.
Is it regular? Because I have a doubt here.
Yes.
Fine. Then the urination frequency would have been normal. Any exercise or the physical activities?
Not regular.
Not regular. Okay. Fine. So you can call it as the irregularly regular. What about the mobile usage?
7 to 8.
7 to 8 hours per day. Fine. What are the you have been observed in this?
Eyes, today they are little reddish because yesterday we have traveled.
Okay. Then?
Tongue is normal, pinkish in color.
Okay.
Lips,
Average. Okay. Yeah.
hair, frizzy.
And the skin?
Skin is normal.
That's fine. Fine. Yeah. Thank you. So, this exercise is done just to the assess, and you cannot find any major of the disease cases here. But at least just we will understand what and all the questions we can take it. Based on the colors and also based on these questions, I can say, see the water intake, one of the very major. One of the primary cause for the constipation. And the constipation is the reasons for the recent cardiac arrest. Okay, you can say take the recent papers also, you can share the most of the publication papers. The recent causes for the cardiac causes, they are the mainly in the constipation. The reasons for the constipations are the different. It may be not only the water intake. I can say, I had one patient of severe burning micturition when I was my clinic at Bangalore JP Nagar. So he said that I had the burning micturition. I told him to just nothing but drink around 3 liters of water per day. So within 3 days, in my next visit, he said almost the 80% of the burning micturition has been reduced. Nothing else. Okay, so this is one point we have to focus on about the dry skins and along the constipations also. Okay, when the patient comes with a dry skin, you can directly say that. So because you know that water intake is very essential for the normal digestions. Fine. Then it is the sleeping durations. You know that what are the importance of the sleeping durations. Waking time of early, it's must. As well, the early going to bed is also the very best. Because of the changes in the physical body as well the hormonal changes what you can see, that is the reason. Then bowel pattern, it's fine. Urination is a fine. See, bowel pattern in the modern ways, the recent complaints we are getting much more even from the software engineers. It's like they leave the home quite early, and especially the urination what we have been seeing during the COVID period. Even my wife, she works for an INFI. She said they were said in the office it's to keep the water away so that they will go maximum time to drink the water. Because during the COVID period, during the quarantines it was, and the longest distance was passed by a person from the hall to the bedroom or the bathroom, that's all. Not even out of the home, correct? So they were saying you keep the water bottle some far away so that we can drink the maximum water. No, I converted it. I said them, you have the water near to you so that you will drink, so you'll go for the urinals maximum. That's how, because even though you're thirsty, you can control for half an hour. But if the urge comes, means you have to go immediately. No any other options. Correct? So that's the reason urinations as well. And the exercise, fine. It may be involved one or the another way. It may be the regular physical activities or in the walking kinds. As well, the last one, it is, I no need to explain further because you all are well educated about that. And we cannot live without also, and we should not be dependent on that also. That's all we have to understand at last. So ultimately, I'm coming to the end of the sessions. The chromo, the color, has to be used in diagnosis of the various kinds of the diseases. Once the diseases you have been found, you can find the cause itself. See, few of the cases, I'll give the one beautiful scenario what we had, and in our Dharwad MD studies. I'm happy to share two of my classmates are also here, batchmates of MD. Shakti Anna is there, as well Dr. Prazul is there. Say both of we studied MD with the 3 years. Okay, so there we were in the department of the medicine. Dr. Jayashankar was there. One patient had come with the severe headache. Okay, lady with the headache. What he did, Jayashankar directly forwarded to me just to look into that case. That's all. So we went with the examinations. There was a very dry skin, the xerophthalmia, the dry scleras also, and she was having the headache. I asked her first question, what is the water you drink per day? So she said, I'm drinking hardly 2 glasses of water per day. Then I said, you have to drink at least of minimal 1.5 to 2 liters of water, then we will see. The patient came in only with the complaint of the headache, nothing else. I told this, the patient went off. After 2 weeks, the patient has come back, and she was searching for me. She was running all around the units. There are 3 units in medicine. She told, doctor told me to drink the water. Where is that doctor? She was searching because she was not knowing my name, and we are on the visitors there. And the next day, she met with the unit head, Dr. Jayashankar. Then he asked, how did you diagnose that she was having not drinking the water? Because of that, she has the headache. I said, because of the dry skin, what she had, dry hairs, as well the xerodermas. And we started with our water intake. Automatically, it has been come back to the normal. This is what we are failing in the modern systems of the medicine. Whenever the patient comes, we'll say that, okay, you take this medicine, this is sufficient. Today morning, we are discussing why the diabetes are high in number. Diabetic patients are high. The reason because there is no medicine? No. The peoples are unaware how to control it. That's all. If we educate them about the control of the diabetes, that is sufficient. Right? Most of the kind you can look into the AIDS cases. right? HIV infection. Before, the HIV infections were very high, but later when the patients are, the peoples are aware about to avoid the getting these kind of the infection. Right now the HIV complaints are very much lesser compared to that. The same way in the diabetes also. If you give education, that will work on well. Okay. So with this, I would like you to pass a message on utilize this workshop very well, because by tomorrow we have the excellent sessions. One is on the pulse diagnosis, this on tongue diagnosis by Raghavan Sami, as well the iridoscope, Dr. Sridhar Pulipati. Okay, he will bring with the iridoscope also, so that you can learn that how to utilize that in your clinical practices once you go it for the clinicals also. Okay, utilize best of them. With this, wish you all the best. Thank you.
Thank you so much, sir, for the wonderful session. Now I would like to request Mr. Ajit to present the token of gratitude to our dear principal.
So next we'll have a tea break, and after the tea break you can disperse, and we'll meet you by tomorrow morning 9:30. Okay, 4:30 onwards you'll get those who go to the Gardenia hostel, you'll get the bus